Oh, they're not till the second and third, okay.
They're not here.
Okay, great. So good afternoon and welcome to bill hearings for the House Health and Government Operations Committee. I'm your chairman, Jocelyn Peña-Milnick, joined by my vice chair, Bonnie Cowles, and to my left, I'm going to go through some of the rules for this committee just to make things go smoother for us, okay? Keep in mind that some of those rules we're a little flexible, especially when the sponsor is not here and we have to go on to another bill, so there's some flexibility there. I kindly ask for your patience, first of all, if we encounter any technical or streaming issues. It does happen sometimes, but it's okay, relax. We're gonna get to your bill, I promise you. Please set your electronic devices, and I am about to do the same because I sometimes get embarrassed when it rings. And if you must carry a conversation, please go outside. As a reminder, there's no food or drink allowed in the gallery because then our staff has to clean it. You'll see that we do drink, but it's because we're sitting here for 4 hours and we need to drink. Otherwise, we'll get sick and there'll be no bill hearings for the remainder of the week. For each bill that we hear, we're going to first hear from the bill sponsor. In this committee, I have decided not to time the bill sponsor, but please don't abuse it because then I have to cut you off, and I do not like to do that. The rest of the witnesses will have 2 minutes to provide testimony, and you will see a time display right there on your left. Please, when the time has expired, I don't want to be rude, just wrap it up. Please wrap your thought up. If you need a few more seconds, I will do that. Please adhere to our wonderful committee. I want to thank you for coming on time. I'm so grateful. Please adhere to our usual committee rules of 1 question and 1 answer. And please keep your question brief. Please direct the question to the one person on the panel so that we don't have everyone answering the same question and we'll be here forever. Members of the public, you'll be able to view the live stream of this hearing on the Maryland General Assembly website and YouTube channel. I'm now going to go through the order of the bills, but remember that I may change it, okay, depending on whether I have all the witnesses and sponsor. So the first one will be House Bill 875, Delegate Allen. Will you be so kind and come up with your panel while I go through everything else? And I believe that your panel, you have Secretary Woods and David Dragics, Kurt Serber are on your panel. Patrick Murray and Andrew Gross, if they can come up first. And you notice that's a favorable panel. And then after that, I try to be fair in this committee. So I will call a favorable with amendment or an unfavorable just to be balanced. After this bill, we have House Bill 1012, House Bill 1276, House Bill 464. Then we have House Bill 878, House Bill 994, House Bill 877, House Bill 962, House Bill 894, House Bill 959, and House Bill 1053. I heard my New York accent there for a second. So House Bill 1053 will be the last bill of the day. So good afternoon, Delegate Allen. Will you be so kind and get started with your testimony?
Yes, thank you, Madam Chair. Madam Chair, Madam Vice Chair, members of the Health and Government Operations Committee. My name is Delegate Nick Allen, and I am here to testify in support of my bill, House Bill 875, which seeks to protect veterans from predatory VA claims sharks and bad actors. As some of you may know, I'm a proud Army veteran with multiple deployments to Afghanistan, and I've also been through the entire VA process, from filing multiple VA claims to being evaluated to appealing those claims and everything. I'm very familiar with the VA and its whole process. We have all heard stories about the slow-moving and dysfunctional nature of the VA. And while my experience has been largely positive, I know that isn't the case for everybody. Specifically, the process for filing a claim and later appealing that finding can be incredibly difficult to navigate. As a result of all this, an entire industry has arisen around the filing of VA claims and appeals for veterans. A lot of people have made a lot of money as a result of the VA's dysfunction. I believe this creates a perverse incentive around helping veterans and their claims and their appeals. Under current federal law, it is illegal for anyone to charge a veteran money for filing an initial claim. Additionally, it is illegal to charge a veteran to assist in filing an appeal unless the entity that's assisting the veteran is an accredited veteran service organization, or VSO. And they are accredited by the federal VA. I will say it again, this practice is already illegal. Additionally, many of these groups charge exorbitant fees to veterans beyond what accredited VSOs are allowed to charge. In fact, veterans can and do already have choices when it comes to filing their claims and appeals. They can go to any accredited entity who often don't charge them a dime, including the Veterans of Foreign Wars, or their VFW, the American Legion, Disabled American Veterans, the Maryland VA, and many county governments themselves have accredited VSOs on staff. However, in 2006, all penalties for violating this federal law were repealed. There are currently 2 pieces of federal legislation that seek to address this problem, but they're being held up in Congress currently. And let's be honest, they probably aren't going to pass anytime soon. So frankly, our veterans cannot wait. HB 875 as written aims to remedy this. Really, it's very simple. The bill will give Maryland's Attorney General, who himself is a veteran, the power to enforce this law at the state level and to protect Maryland's veterans from bad actors. I want to thank my panel and especially Secretary Woods for coming to testify and support today. I also want to thank our friends who are here to testify as favorable with amendments. We've been working together to come to a solution, and I'm confident that their proposed amendments are being offered in good faith. I know that this committee, Madam Chair, prides themselves on being deliberative and conciliatory, and so in that spirit, I have remained open to finding a workable compromise for all of us. I know we're all passionate about this subject and about protecting veterans and serving our veterans. Speaking as a veteran, I know that we signed up to serve, but we did not sign up to get scammed. Thank you all for your time. I'm happy to answer any questions.
Thank you. Good afternoon, Mr. Secretary. How are you?
Very good, Madam Chair.
You are a regular here. You're gonna have to start paying the sunshine fee.
There you go. If it makes you feel better, I'm nervous every time. Madam Chair, Madam Vice Chair, and members of the committee, I'm Tony Woods, Secretary of Veterans Affairs for the state of Maryland. I'm honored to appear before you today, and I respectfully ask the committee for a favorable report on HB 875 as written. This bill seeks to penalize unaccredited actors that prey on Maryland veterans, and I'm grateful to Delegate Allen and Senator Klossmeyer for their leadership on this. Since my department's creation, in partnership with the legislature, we've invested Maryland taxpayer dollars into creating a benefits program that accredits veteran benefits specialists and assists veterans with filing their initial claim. We do this at no cost to the veteran. Last year, my department made 153,000 contacts with veterans, submitted nearly 4,500 claims, resulting in $40 million in compensation benefits for veterans. We have a 95% claims approval rate as well. These benefits have helped veterans thrive economically here in our state. For years, federal law strictly prohibited unaccredited individuals from charging to assist veterans in filing their initial VA claim. Unfortunately, these penalties, as Delegate Allen pointed out, were removed in 2006. This change has enabled bad actors, often based in other states, to take advantage of vulnerable veterans. Claim sharks often operate by promising a veteran guaranteed disability rating in exchange for a cut of their earned benefits. If documentation is thin, sometimes claim sharks have been known to work with unscrupulous medical professionals to produce fraudulent documentation. When a veteran unwittingly submits a claim that includes this kind of documentation, it opens that veteran to penalties and even criminal prosecution. Further, while my department helps Maryland veterans obtain their benefits free of charge, which they use to improve their well-being, out-of-state claim sharks often siphon off these benefits and bring their ill-gotten gains to other states. Finally, any claim sharks that violate this law will be fined and have those fines deposited in the Maryland Veteran Trust Fund, which, as you know, provides vital assistance to veterans and their families who have fallen on hard time. And so while we wait for legislation at the federal level, we are incredibly strongly behind HB 875 to fill the gap to protect Maryland veterans. So with that, I just ask for a favorable report and say thank you for your time.
You're welcome. Next, please.
Chair Pena-Malik, members of the committee, thank you for the opportunity to testify in favor of Delegate Allen's bill. I'm Dave Dragic, a retired Army Colonel and Legislative Director of the Maryland Military Coalition, representing 150,000 uniformed services connected individuals. When the 2022 PACT Act expanded benefits for veterans, unfortunately, it opened the door for new tricks and scams to rob veterans of their valuable benefits. Claim sharks, professionals who use aggressive tactics through the mail, telephone, and online tools to take advantage of veterans, their families, caregivers, and survivors have swarmed. Their messages are engaging, easily misleading veterans with offers of assistance that seem too good to be true, especially those veterans either applying for benefits or appeal services for the first time. These actions often result in not only fees that can run up to 50% of the settlement but also identity theft of the veteran's personal information. We cannot continue to allow these practices to continue. HB 875 is a strong positive step in stopping these predatory practices on Maryland veterans. It incorporates federal law with Maryland rules on the division of fees for attorneys providing these services. And it will require those people who charge a fee or receive compensation for providing these services to comply with Maryland's ethical standards for attorneys. This type of regulation and accreditation is needed to protect Maryland's veterans from unscrupulous or unqualified actors. The Maryland Military Coalition strongly supports HB 75 and asks for a favorable report from the committee. And we'd like to thank Delegate Allen for sponsoring this legislation and appreciate his leadership on this issue.
Thank you. And State Treasurer Davis, I'm calling you second. Welcome to the committee. Welcome. I'm going to call you Bill next after this one. Just wanted to welcome you. Mr. Kurt Serber, are you here? Will you please come up? And then also, may I have Patrick Murray and Andrew Gross? Can you pull your chairs up, please, to the panel? Thank you. Sir, you can get started. Thank you.
Thank you. Madam
You're
Chair,
welcome.
Madam Vice Chair, committee members. I'm Kurt Serber, the commander of VFW Post 304 right here in Annapolis. And I'm the VFW state representative for Maryland. I'm here today on behalf of the almost 360,000 veterans in this state. The VFW is committed to putting predatory claim sharks out of business, and our efforts in Maryland complement our larger efforts in Congress. We have a coalition of national veteran groups as our allies in these efforts. However, our bill in Congress is stalled, as claim sharks spend millions on lobbyists and have been pursuing federal legislation to legitimize their actions. Clearly, their predatory practices must be very lucrative. These claim sharks are using their money to clog up the works in the Beltway. We are looking to protect veterans here in Maryland with HB 875. The VFW knows that unaccredited companies like Veterans Guardian bill thousands of dollars for their services. The actions were banned recently in New York and New Jersey. Veterans Guardian lost a challenge to the New Jersey law this month, and they are being sued in North Carolina for charging illegal fees. Another group, VA Claims Insider, is being sued by the Texas AG for defrauding veterans. The VA has issued fraud alerts because of the actions of companies illegally billing veterans. The Veterans Guardian is even lobbying right here in Maryland to nullify this bill. That's not what Maryland veterans want nor deserve. There are VA accredited employees working for veterans organizations like the VFW and the DAV who do VA benefit claims free of charge. As a matter of fact, the accreditation and recertification for all VFW service officers takes place right here in Annapolis. There are also VA accredited attorneys and Maryland's own Department of Veteran Services that do great work. The VFW asks that you unanimously adopt HB 875 and deny the amendment put forth by Veterans Guardian so that we can protect Maryland veterans and their loved ones. I thank Delegate Allen and our supporters for championing this important legislation. Thank you.
And thank you for your service. Next, please.
Good afternoon, Chair Pena, Melnick, and members of the committee. Thank you for the opportunity to provide remarks. Today, I have the honor to speak on behalf of VFW members from the state of Maryland. I am also the VFW's legislative director at the VFW National in Washington, D.C., so I have been personally involved with this issue on both fronts. With the passage of the PACT Act, the VFW has observed an increase.
Give us your name for the record, please.
Oh, sorry, Patrick Murray.
Thank you.
We've seen an increase in online advertisements that target veterans and survivors' earned VA benefits. Many of these groups promise to increase VA disability ratings. They argue that charging thousands of dollars some way make them more effective in assisting veterans in the free services offered by state, county, and veteran VSOs. Under VA statute and regulations, fees charged for claims assistance are capped and usually only apply to a percentage of retroactive benefits. However, many of these unaccredited consultants use contracts that include a commitment by the veteran to pay all or a significant portion of their increased benefits. To be clear, there are no restrictions for anybody to be accredited by VA. Individuals must take 40 hours worth of training and pass a test. They then must pass a background check. That's it. These are not insurmountable hurdles to becoming accredited. The only thing that would change is how these companies are allowed to charge for their services. This bill would ensure that anybody who wants to assist veterans and charge fees for that assistance is doing so under well-established laws and regulations. I stand here as a Maryland veteran representing other Maryland veterans, urging you to pass House Bill 875 as written. I'd like to thank Delegate Nick Allen for leading the way on this. We stand ready to answer any questions you may have.
Thank you for your service. Next, please, if you could just move chairs, that would be great. Thank you very much for your flexibility, Mr. Andrew Gross. How are you, sir?
I'm doing well, Madam Chair. Thank you for having me. I go by Andy. My name is Andy Gross. I'm an attorney based out of Towson, Maryland. I represent veterans before the Department of Veterans Affairs in appealing denials of benefits or under ratings. And I have dedicated my practice to this area. Let's cut right to the chase. I'm accredited by the Department of Veterans Affairs to handle these kinds of claims. If I was not, I would not be allowed to charge fees for this kind of benefit at all. I'm very proud of what I do and the results that I've achieved. And I would encourage anyone who wants to help veterans to get accredited and to join me in this fight to get veterans the benefits they've earned. Those are the good guys. There will be folks testifying at some point today saying that they're the good guys, but you can't be the good guys and do illegal things. You can't be the good guys and charge illegal fees for juicing a claim with, in-house doctors or contracted doctors. You can't charge predatory fees to get these benefits and still be the good guys. One thing I learned early in my own Army career is an expression: if you have a choice between the hard right and the easy wrong, take the hard right. You take the hard right. In this case, the hard right is to work hard on a veteran's claim, to figure out what's going wrong inside the file, to help the veteran build up the evidentiary record, and then ultimately submit it and appeal it if necessary. And if they hire an attorney for an appeal, there's a proper fee for that as well that is based on retroactive and not future benefits. The easy right is stuffing some medical opinions into the claims file and then taking $10,000 or more for the service. It's illegal, it's wrong, and it's intrinsically predatory. They are not the good guys.
Thank you. I'm going to open it up for questions now from the committee. Any questions from the committee? Delegate Rosenberg, followed by Delegate Lewis.
For the legal counsel, would it be fair to say that this issue is preempted by federal law? Or what is the
Yes.
relationship?
Yes, that's a very fair question. Yes, it is to a degree preempted by federal law. However, the criminal penalties that were in effect up until 2007 no longer exist. Now, these claims consultants have received letters from the VA advising them that what they are doing is illegal, but there's no teeth behind it. So it's then left to individual states' consumer protection regimes in order to enforce these federal rules. To that end, I don't believe it to be preempted. This would codify this as a consumer protection action in the state of Maryland, as other states have done. So yes, the structure of how individuals are accredited and can charge fees for appeals is a federal matter, but whether or not it's a consumer protection action can be a state issue.
Delegate Lewis, followed by Hutchinson.
Thank you, Madam Chair. Thank you,
welcome.
Delegate Allen, for bringing this bill. Thank you, Mr. Secretary, and all our panelists. Thank all of the military veterans for their service. It means a lot to have you here. It matters that you're here, so we are listening. I have so many concerns. It does seem unethical for private companies to profit off the backs of veterans. But I am wondering, what is happening that veterans are unaware they can come directly to your agency, Mr. Secretary? Why are they going to these predatory claims sharks? Why are they going there? And what can we do to support your work in reaching veterans first?
Well, Delegate, first off, thank you very much for your comments and for your concern. I'd probably raise a couple of points. So one, the reason why my department last month had a 95% claims acceptance rate is because we believe in looking at the veteran's entire service record and submitting a claim on their behalf, working with them to submit a claim that is based on evidence, that is based on accurate information. Sometimes when a veteran feels as though that they ought to have a different disability rating, that could lead to frustration. But we think it's incredibly important, and not only that, by being accredited, there's an ethical standard associated with this, which requires us to only do that. And so, if a veteran finds themselves frustrated with a potential outcome, they may turn to those who would promise a better rating, or promise a higher number, or promise different compensation. And so that's certainly what can open it to that. So that's the first piece that I'd say. The second piece is we actually agree that we need to do a lot more. Governor Moore made it clear that a responsive government is our obligation and responsibility. That's actually why we now measure performance indicators to understand, well, what is the wait time for a veteran today? How can we invest more personnel in making sure those wait times come down and we provide representation? But I'll also say that we were very appreciative of the fact that there's a VSO landscape. There are accredited organizations who are willing to represent our veterans and take care of their needs, and we're happy to work in partnership with them because they hold up those ethical standards and make sure their folks are accredited. Thank you.
Absolutely.
So the impression I get is that the VSO organizations function a little bit like navigators in the healthcare insurance space. They kind of warm handoff, or they're very accessible. Every veteran knows they have their VSO, I'm assuming, and they're providing guidance about how to get the service that they need, or the response that they're looking for. I'm just trying to, because I'm not familiar. I just want to understand. There are a couple of ways we can protect veterans. First, by making it impossible for claim sharks to function in Maryland, but also making it easier for veterans to have a wraparound support service to get the help they need. Thank you. Just want to understand. Thank you, Madam Chair.
Ma'am, for VSOs, for example, like the VFW, we operate very similar to what Secretary Woods has. Ours are just different employees. We have accredited representatives that will file claims, just like the state service officers or many county service officers do as well. The DAV, the American Legion, also provides services like that. We can do the full suite of package for filing a claim, just like Secretary Woods' employees can. We just work for different folks. But one of the things you mentioned, why do veterans not know about this? If you Google right now, veterans claims assistance, some of the top hits are not going to be the free ones. Some of the top hits are not filed through Secretary Woods' Department of Maryland Veteran Affairs or VA. Search engine optimization puts a lot of the results at the top. So that's why veterans are picking them first, because they're the first results on Google.
Okay. I have next Delegate Hutchinson, followed by Delegate Shalega, then Vice Chair Collison.
Thank you, Madam Chair.
You're welcome.
Perhaps for the delegate, but whoever you think's the right one. I'm just a little confused because it says favorable with amendments with the guardians. Yet I read one of the letters and they say they're outright in opposition. I can't tell from my witness list. Are they going to be testifying here today?
Yeah, they're going to be testifying, and they have a set of amendments. We've been kind of going back and forth with them, and like I said, I appreciate the work and I appreciate the good faith. We haven't come to a final agreement on the amendments. There's we added some stuff as recently as Friday when we were kind of going back and forth.
Okay.
But I kind of just wanted to flag that they're coming in favorable with amendments, but my panel is here. They're testifying just on the bill as written.
Great. I'll reserve my question for when they come up then. Thank you.
Thank you.
Delegate Shalega, followed by Johnson.
Thank you, Madam
welcome.
Chair. Thank you all for being here. Thank you for your service to our country. It means a lot to us and we appreciate all that you do. And I'm reading some of the opposition testimony saying that the entire state has only 70 VSO representatives to provide assistance to the nearly 63,322 veterans. Now, first of all, my question would be the 70 VSO representatives, that's not individual representatives, is it?
Could it be organizations? Yeah. Well, either way, the math is wrong entirely. There are far more veteran service officers or veteran benefit specialists available in the state than that. But there are also 360,000 veterans who reside here in Maryland as well.
Okay, and then, yeah, maybe when they come up, they can clarify that. I wonder if that 63,000 roughly, maybe those that need a claim, I'm not sure. We'll let them explain it, but my father was a career Army, and he had a prostate cancer later in his life, which they found tied to Agent Orange from his time in Vietnam. And they just awarded him, like I guess, so not everybody needs a VSO. I think according to my parents, and I'll have breakfast with my mom tomorrow and ask her, but I think she told me that because of his health records and his health condition and a direct tie to Agent Orange and other chemicals he was exposed to in the Army, he was awarded an additional monthly benefit. And of course, he's in the VA, so they took care of his health care.
That's correct, Delegate. I mean, every case is different, of course. The whole point of the filing the claims and the appeals, all that stuff, is to prove a service connection in a lot of ways. That's what half the fight is. And it depends on the condition, it depends on the patient, it depends on the veteran that, when they served. For many veterans, Vietnam era veterans who were exposed to Agent Orange, that process tends to be a little easier if they can document when exactly they were in country, when they were exposed. And Congress has legislated that, again, in terms of Agent Orange, and more recently with the PAC Act, which deals with burn pits. So it's a very similar thing where, if you can prove you were exposed to a burn pit, then certain conditions are assumed to be service related. So that kind of speeds it up in a lot of ways. But again, everyone is different.
Not everybody needs a VSO, just those who are not getting an initial approval through their initial claim.
Correct.
That they're needing more info. Thank you for a couple questions.
It's all right. You give good cookies to the committee, so you're entitled. Just kidding. So no, I'm not, and you're right, especially with the sugar ones. Delegate Johnson.
Thank you, Madam Chair, and thanks for bringing the bill. Mr. Secretary, is there on your website, I was just kind of looking through it, do you have somewhere where all the VSOs are listed and what location they're in so folks can have a choice? It's a little bit difficult to find them as I'm looking through your website here.
Delegate, I appreciate that. It's also why we're undergoing a website overhaul for exactly that reason. But you're absolutely right, Delegate. So if you were to click on our Veteran Benefits Service Program, you'll see it there. And that will take you to being able to make an appointment online with one of our 24 veteran benefit specialists. The VFW alone has 203, I believe, here in the state that are accredited. So it is a rich landscape. And one sort of key point that I would just say for all veterans can file their own claims. That is correct. I personally had a great experience when filing my claim, but you always benefit from having an accredited veteran service officer who is helping to give you advice and help you make the strongest claim possible. That kind of outside advice should be free. It is quite helpful. And sometimes, just like, folks who fill out TurboTax to use their taxes, yeah, you might benefit from asking a few questions. You don't need them to represent you per se, but it's always better to when an accredited veteran benefit specialist is supporting your claim.
Sure.
Do you know when you're expecting that revamped website to be up and running?
I think we're actually within 90 days, Delegate.
Okay.
Yeah.
All right. Thank you.
Yeah. Thank you.
You're welcome. I don't see any other questions for this panel. I want to thank you for being patient as we ask the questions. And thank you again for your service. Have a blessed day.
Thank you,
Next,
Madam
we
Chair.
have, you're welcome, a panel of 4 favorable with amendment. That is Ashley Berry, Ray Colas, Ellen Valentino, and William Taylor. And there's one virtual, and the last witness before we have one more unfavorable, and that will be it. Will you please bring that virtual witness up? The favorable with amendment, it's Mark Christensen, so that we can do all the favorable with amendment at the same time. Okay, thank you. Will you come up, please? And as soon as you sit, will you be so kind and give us your testimony? And you have 2 minutes. Thank you so much. Nice to see you.
Nice to see you and thank you. My name's Ellen Valentino. I'm here today representing Veterans Guardian, and our panel here today will go over the issue, answer questions. But I just want to start off by saying, this issue, like money you have seen, has trickled down through lack of inaction on Capitol Hill. And we're here as a company that is looking for the right corrective action at the state, one that does weed out the bad actors, put some protections in place for veterans, but also protects their right in order to seek and grieve the way they want to the VA. VA claims can be daunting at every turn, and navigating the VA system is complex, can be intimidating. I know that as a mother of a veteran, and very frustrating. A Veterans Guardian is a company, veteran-owned, that provides a claim service to veterans at as an alternative. Thousands of veterans, thousands and thousands across this country use Veterans Guardian. So again, that makes it more important to put the right protections in place, but still protect this choice of veterans to spin out and seek alternative help. To that end, we have put forth an alternative direction. I can go a line by line about that or submit it to the committee. I continue to work with the sponsor, but I think it puts strong protections and oversight in place for the veterans, again, still allowing them to have their choice. In closing, I want you to know that we do respect the testimony of the supporters that sat here today. We agree that there needs to be change, and we're committed to working with the subcommittee and the committee to move forward. With that, I'm going to turn it over to Bill Taylor from Veterans Guardian to provide his testimony. Thank you.
Good afternoon, sir. How are you?
It's automatic.
Good afternoon. My name is retired Lieutenant Colonel Bill Taylor. I'm a 23-year Army veteran and founder of Veterans Guardian. We are veteran-owned with over 200 employees who are veterans, spouses of veterans, or spouses of active duty. We are a transparent and ethical company helping ensure veterans receive the benefits they are entitled to based on their honorable service. We've helped over 25,000 veterans last year and have assisted about 2,000 veterans here in Maryland with an annual economic impact of almost $20 million a year, with a 90% success rate and an average of 85 days for a decision. We are transparent about veteran options, including the free services from the VSOs that were represented here today, and our billing structure, which is contingent on a successful outcome, and ensure every veteran chooses to use our services from a position of knowledge. We appreciate highly the intent of this bill. We agree that there are bad actors out there and there are bad practices that need to be addressed, but we believe this takes a blunt approach to something that could use a little more precision. We agree with the desire to protect veterans from unscrupulous actors. However, this bill fails to address any specific actions. It just does away with an entire industry. We believe a better approach is to legislate guardrails against the specific practices while maintaining freedom of choice and options for navigating this very difficult process. We have been working at the federal level for the last couple of years in a bipartisan manner to pass the PLUS Act, which would be very similar to our proposed amendment. And we hope that we can achieve that same end here in Maryland. I would like to correct a couple of statements. It has been said that we are currently operating illegally. We disagree with that statement. The current law does not say you can't assist unless you're accredited. It says you can't assist as an agent or attorney without being accredited. And as long as we're not stepping over the line to agency and representation, we are not violating the law. Additionally, there is a bar to companies like being accredited. The accreditation process is just for individuals. Thank you.
Thank you. Next, please.
Thank you. Thank you, Chair, members of the committee. My name is Ashley Berry. I'm Senior Vice President of Communications for the National Association for Veteran Rights, or NAVR. It's a national trade association that promotes ethical and transparent business practices among companies engaging with the service-disabled veteran community, companies including Veteran Benefits Guide and Veterans Guardian, who you're hearing from today. At NAVR, we set standards in certifying companies to provide good service, for a reasonable fee, a fee veterans are willing to pay. Veterans choose that service to get their claims done correctly the first time. I'm also a proud resident of Maryland, a former senior executive at the U.S. Department of Veterans Affairs, and I spent 2 decades as an investigative journalist for multiple television networks. During my tenure as a reporter for CBS News, I was at the helm of the Phoenix VA waitlist scandal, giving whistleblowers a platform to tell their stories of the atrocities that happened to our veterans who were forced to wait for benefits and for care. In fact, my coverage generated congressional inquiries and hearings led by the late Senator John McCain and Senator Kirsten Sinema. Because of what I uncovered as a journalist and my work on the other side of the VA national office, this is the reason why I'm testifying before you today. I am here to highlight again the reality of wait times in the benefits process. You may have been told from certain veteran service organizations that there isn't a capacity issue, but I'm here to tell you the facts in Maryland. Currently, there are more than 355,000 veterans. The actual number of VSO representatives is 90. So that means there are nearly 4,000 veterans per one VSO representative. Additionally, more than 19,000 pending claims, nearly 40% of which have been pending over 4 months in Maryland. And when you're talking about our nation's heroes having to wait that long, it literally can have deadly consequences. Substandards should not be accepted as the norm. Our veterans deserve better, and we help make that happen at the National Association for Veteran Rights. Thank you.
Thank you. Next, please.
Yes, dear Chairwoman Pena Melnick, members of the committee, my name is Ray Colas, and I'm here today on behalf of Veterans Benefits Guide, or VBG, to testify with concerns to House Bill 875 as currently written. VBG provides veterans with a private, legal, and federally compliant option outside of the Veteran Affairs, ensuring veterans receive the benefits that they've earned. Now, VGB strongly supports the bill sponsor's commitment to protecting our veterans and actually believes that the bill does not go far enough, as it is absent necessary disclosures and fee caps. However, and most unfortunately, this bill prohibits services of honorable for-profit organizations such as ours who serve veterans. Now, the proponents of the bills have inaccurately insinuated that organizations such as ours choose not to be accredited. Federal law states that no individual may act as an agent or attorney in the preparation, presentation, or prosecution of any claims under law administered by the Secretary without first being accredited. I would like to state for the record that we do not practice law, we do not act as the veteran's agent of record, and we do not present before the VA. Federal law also states that VA recognized VSOs and their representatives always provide the services or the benefits claims free of charge, and that only VA accredited attorneys and claim agents may charge fees for assisting in a claim for VA benefits. Simply put, as an accredited VSO or an accredited representative, there is no path for services for honorable for-profit companies such as ours to serve veterans, and that is our primary opposition to the bill. Unfortunately, the bill as currently written proposes to increase cost to veterans while reducing freedom of choice, representation, and access to veteran services. It is for that reason we asked Delegate Allen to consider our concerns to secure our support for House Bill 875. I would like to thank Chairwoman Pena Melnick for the opportunity to engage on the bill.
Thank you. The person here, the virtual person, no? Okay. Are there any questions for this panel? I see Delegate Riley.
Thank you, Madam Chair. Yes, I think, I'm not sure if the gentleman that just spoke or Ms. Valentino, what is the exact amendment? Did you say that?
There's a document that I will circulate that we are still working with Delegate Allen as of Friday. But what it does is it lists a number of protections in place, and I can go over them now. It caps the amount of compensation. It prevents a company from an individual such as this from operating on a fee-based basis. It requires a background check by our employees in the state. It also prohibits us from hiring or using any kind of medical providers that we have in place as well. I can go on and on.
All right, that gives me an idea. Thank you.
So it is, and it has penalties and protections in place as well. So I will circulate this immediately, but out of fairness and consideration, I was hoping to get it finalized and aligned with the sponsor, although I do recognize the private deliberation of the subcommittee and this committee as well. Thank you.
Delegate Kipke, followed by Delegate Lewis.
Thank you, Madam Chairman,
You're welcome.
and thank you for those comments, because a lot of that sounds very helpful. For Mr. Taylor, we've all been given a litany of like lawsuits against the company and things like that, and before you got here, so I'd like to give you an opportunity to
Of course.
respond to the negativity that has been directed towards your company. And also, one thing that when you said you don't operate as an agent, it kind of hits my ear sideways, it doesn't, like, how are you not an agent? So if you could address that as well. Thank you.
So I'll start out with the agency. The VA in 2006, when they passed the current version of the law in their explanation of the rule, they defined agency as completing the power of attorney form and then acting as a representative. If you look in Black's Law Dictionary, agency means representing in place of someone before another entity. As long as all we're acting as is consultants, and we do not submit on behalf of a veteran, and we do not prosecute on behalf of a veteran. We are merely consultants to help them navigate the process on their own behalf. With regard to the lawsuits, I also thank you for that question and the opportunity to address it. There is a class action lawsuit against us, but it is not based on any of our actions, and it is not claiming any specific damages from our actions. It is based solely on the premise that we are violating federal law, and therefore, since we're violating federal law, any of our contracts are null and void. We disagree with the assessment of that lawsuit, and we believe that we are going to be successful in showing that we are not violating federal law right now, contrary to a lot of the statements that were made here today.
You're welcome. Delegate Lewis, followed by Shalega.
Thank you, Madam Chair, and thank you to the panelists. First, I think I understand the business model. It is like a facilitation service. You provide a consulting service. It's a facilitation for veterans to access their benefits. Okay. It sounds a lot like what we do in the health insurance space, which may not be as familiar. I'll just say we talk in terms of navigators, individuals who work to connect people with good health insurance plans. So you're kind of like a middleman solving that problem for a consumer. What I am finding difficult to understand is how a navigation service, a facilitation service, ends up in a lawsuit. And in the health insurance space, navigators are employed by nonprofits that connect people to insurance. The profit model seems to me, my personal just understanding, to be an added factor that's complicating and leading you into a situation where you're under a federal lawsuit. So I'd like to understand better how, in your view, whoever is best to answer, how a for-profit model of facilitating or connecting consumers is more efficient than the nonprofit model that we use in the health insurance space.
Thank you for those questions. First, it's not a federal lawsuit. It is a civil suit on behalf of former clients of ours, and it is predicated solely. It is not addressing any of our practices. They're not accusing us of malpractice. They're not accusing us of doing anything wrong. Both of those clients were successful. It is merely they're looking to take advantage of the situation and try and make some money, claiming that what we're doing is illegal, which we fundamentally disagree with. With regards to what makes us different than the VSOs, we believe that there is room in this space for everyone. Our veteran community is fundamentally underserved right now. But there is room for the VSOs, there is room for the attorneys, and there's room for private companies. One of the very first things I do when a veteran comes in my door is make sure they know that there are free services available. And if they want assistance finding them, we help them find those free services. That's how much demand there is for services, that I don't have to hide the fact that there are free services available. Where we come into play, veterans are making that choice for a host of different reasons. It might be about accessibility. I have folks in my office from 9 o'clock in the morning till 9 o'clock at night. I'm going to answer the phone anytime that you call. It might be an issue of a complex case that requires a very extensive medical record review. I have a team of nurses who will help really dig through the evidence and help develop the evidence. But veterans should be free to make that choice as long as they're doing that from a position of knowledge. I agree 100% with everything that was said before here. If you're lying to veterans and telling them that I'm your only choice, or I can guarantee something, or anything along those lines, and I believe you deserve to be prosecuted. That is not what we do. And that's what we hope the amended protections in this that we're proposing will stop those kinds of practices, but still allow us to continue to operate.
Sure, Delegate Shalega.
Thank you, Madam Chair. Thank you all for being here, and thank you for your service as well. We appreciate it. There was discussion about accreditation or certification.
Yes.
That you are not. Can you address that?
Yeah, thank you for that question. First of all, we are seeking to reform accreditation. I want to be accredited. We are working, there's a bill called the Plus Act sponsored by Lieutenant General Jack Bergman out of Michigan, the highest ranking military officer to ever serve in Congress. That bill will create a path to accreditation for our company and other companies. It will allow us to have oversight from the VA, but it also puts in all the guardrails that we're recommending with this amendment. The problem with current accreditation is that it is in an individual model. So you get individuals accredited. They do not have an accreditation system for a company. So it would be prohibitive for me to try and get 200 employees accredited by the VA. And then every time I hire a new employee, I would have to wait 3, 4, 5 months for that accreditation to come through before that employee could work. So first of all, there isn't a path for companies to become accredited. Second, the current accreditation model limits an accredited agent to only assist with an appeal. We believe in looking at a veteran holistically. We look at things that they should have claimed that they didn't based on their service records and their medical records. I could not do that for a fee as an accredited agent. Then we look at secondary conditions. I've got a back problem now. My legs bothering me from radiculopathy. That's a secondary condition. I would not be allowed to assist with that as an accredited agent. The only thing I could assist with are things that you either have been denied for or we feel you're underrated for. We believe that that does not, as our model, that does not fully service a veteran. That's why we're operating unaccredited, but we are trying to become accredited, and we are working at the national level to reform accreditation to allow that.
You're welcome. I have Delegate Johnson followed by Chisholm.
Thank you, Madam Chair, and thank you for coming to kind of help explain all this today. Can you, if you can you explain the difference in, because I see the attorneys get paid.
Yes.
So could you explain the difference in your fee structure versus the attorney's fee
Right.
structure?
So the accredited attorneys are for-profit entities. They are working on appeals. So if a veteran's case gets denied, the attorney will come in and will file an appeal. The attorney's fees under the current accreditation model are based on a back pay scenario. So they can take anywhere from 20% to 33 1/3% of whatever back pay is awarded based on the appeal. And depending on how long the appeal process takes, that can be anywhere from 6 months worth of back pay to years and years and years worth of back pay. And so, attorneys' fees, yes, they are defined, and I believe they're fair. And I believe that attorneys are operating very well in this space. But they are collecting a fee, and sometimes that fee can be in the tens of thousands of dollars, depending on how much back pay there is. The second part of your question is our fee structure. We work strictly on a contingent basis. If the veteran does not get an increase in their compensation, there is no fee. If a veteran gets an increase in their compensation, our fee is 5 months of the increase. So if a veteran comes to me at 50%, making about $1,000 a month, and we get them to 70 or 80, and they're now making $1,500, our fee is 5 times that $500 difference. We offer payment plans, 5 or 10 months with no interest, no fees. That is a one-time fee. We don't touch back pay. There's no upfront fees. And once that is done, the veteran enjoys the benefits for the rest of their life.
You're welcome. Delegate Chisholm, I believe you have the last question.
Thank you, Madam Chair. And Delegate Johnson started to hit on what I was looking at. As far as the fee structure, I spent 20 years as a VA mortgage lender and understand the service-connected disability and the ratings and the percentages. And one of the things that struck me was when I was looking at some of the, things on the Google machine was the way that you get paid that you just described, that you get a higher commission rate based on the rating level. And one of the things I did live through was the financial lending crisis, predatory lending. And first thing that Dodd-Frank did was came in and said, you can't make money based on the interest rate, meaning if you charge a higher interest rate, you can't get paid more. And I see a strong correlation, and you can take issue with this. But I think this, if you were to be federally regulated, I would think that the federal government's going to have a very difficult time approving the way that you set your commission structure, because you're actually trying to, even though it does benefit the veteran, which I agree with, we should try to benefit the veterans, it gives incentive to almost falsify documents to get that higher rating, even though that's what we want for the veteran. It is incentivizing you to get a higher rating so that you get paid more, the veteran as well, but it provides a higher commission to you. And it's just my thoughts on it. Do you feel like you're compromising yourself at times by trying to push the limit on some of these service-connected disability ratings?
No, I don't. An interesting, so just to get to that number, I have about 10,000 veterans a month call me. We only convert about 2,500 of those to clients every month. What's happening to the other 7,500? A good bunch of them, I tell them the free services are available, and they go, wow, thanks for that information. And they go work with the VSOs, and we wish them well. The rest of them, we do a very thorough evidentiary review right up front. And we're looking at medical records, service records, and if the evidence isn't there to support it, we're not going to help push forward a claim. Our fee structure, yes, is based on the amount of the increase, but that's also very highly tied to how much work we do. Typically, if I'm helping a veteran do a 10% tinnitus claim, I don't want to charge them the same amount that I'm charging someone to do a very thorough PTSD claim that's going to involve medical record reviews, that's going to involve service record reviews, that's going to deal with validating their stressor events. And so that I actually lose money on about 40 to 50% of the claims I do, because it costs me, there's a certain amount of cost for me to run someone through my system. And that 10% claim is, I'm going to treat that client the same way I do someone that's getting a 60% increase. But our fee structure is tied to the success of the veteran. And I'm not going to do anything fraudulent, because regardless of what the current law says about us operating in this space, current law does cover fraud. Current fraud law, if I'm committing fraud, I can be come after by the federal government and any state right now. And that's my incentive to not commit fraud.
The need for your service, and I understand your business model, but it also speaks to that you really only you want to help people, veterans that you can make money off of. It is a business model, I understand that, but
Yes.
you're pushing along people that you can't really help. So understand. Thank you, madam.
Thank you. And we did call the other favorable with amendment for the record who was virtual, Mark Christensen. I was told he's not there. The last, so I want to thank you for your service. Thank you for your testimony and your patience. The last witness for this bill is Mr. David Sussman. Will you be so kind and come up, please? And give us your testimony. Good afternoon, sir.
Good afternoon, Madam Chairman. My name is David Sussman. I'm from Potomac, a 24-year veteran of the Army and retiree. As a veteran, I appreciate having so many options of VSOs to offer me support and great benefits whenever I seek them. They also offer a community for social activities and sense of connectedness with other former military comrades. It's nice that so many volunteers in these organizations offer to help others with their VA disability filings. From my perspective, it's hard to distinguish one service organization from the next, nor did I ever get a confident sense that these volunteers individually had the depth or breadth of experience that I would more likely find in a full-time professional advisory service. When I initially retired from the military, I completed the VA disability forms myself, attached my medical records, submitted to various examinations and assessments, and was pleased months later to have been rated a 60% disability. Thought that was great at the time, but more than 15 years later, got the sense that I'd likely left too many issues unaddressed for which I was possibly not being properly compensated. A good friend told me about Veterans Guardian claim consulting. When I talked with them, they had ready tools to help me explore both the visible and invisible adverse impacts of my extended military service. Their intake specialists were very effective at understanding me and selecting the best course of action for my needs. As I was passed on throughout their organization from one specialist to the next, I continued to get excellent and rapid advice and service. I remained in control of the choices, but with each decision, I was provided with the documentation, referrals, expert examinations, and reports, and completed documentation for the VA based upon their massive team and experience achieving success for other veterans. I trust them fully to act on my behalf. Because Maryland is so concerned and committed to supporting its veteran population, the state should encourage maximum access to and knowledge of all choices for veterans in different situations and to advise veterans on those choices. However, in the end, it should be the choice of the veteran to decide which path to take. Thank you for considering this issue for us.
And thank you for your service. Are there any questions for this witness? Seeing none, thank you for being with us today. This actually concludes the bill hearing on House Bill 875. Next, we have House Bill 1012. It is actually state officers and employees require surety bond insurance policy authorized. This bill is jointly assigned to Health and Government Operations Committee with Economic Matters, and today we have 3 members. Will you please get up and introduce yourselves?
Delegate Marlon Amprey, 40th District.
Delegate David Fraser Hidalgo.
Delegate Chris Adams.
What?
Delegate Pippi.
And welcome to Health and Government Operations Committee. Thank you for your patience. Yeah. Oh, but she's on the other one. It's okay. So we have, I'm going to call the following witnesses. We have the State Treasurer, Derek Davis. Thank you for your patience as you waited. We have Jonathan Martin, Laura Athas, and David Chatham from your office. Good afternoon. Mr. Treasurer, how are you?
I'm well. How are you, Madam Chair?
We're doing well.
Thank you very much for having me here today. I will be real brief, ladies and gentlemen. You have a more detailed written testimony for me, so I'll just highlight a couple of points. First of all, House Bill 1012 represents an insurance-related solution that will provide the state with a new governance structure for guarding against wrongdoing by state officials and employees. In a nutshell, the bill provides flexibility with various statutory surety bond requirements. The surety bond requirements exist to ensure that the state is financially protected in the event that a public official or state employee engages in some kind of wrongdoing. With this legislation, I will determine the type and amount of coverage of surety bonds or insurance policies as appropriate unless statute establishes a different amount or approval process. This new structure replaces a committee, the Maryland State Employees Surety Bond Committee, that was established in 1967, but has not met since 2005. My written testimony goes into greater detail about why these changes benefit the state, but I believe that allowing for a choice between a surety bond or an insurance policy and setting guardrails on bonding requirements will better protect the state while serving time and reducing costs. I thank you in advance for your consideration. I respectfully request a favorable report on House Bill 1012.
Thank you for your testimony. Who would you like to go next?
Are you guys just here? I think they're just here for questions, Madam
Okay,
Chair.
wonderful. Thank you. So I'm going to open it up for questions now from both committees. And since we are hosting, I'm going to start with Economic Matters. Any questions? No? All right, so then I'm going to come to HGO. I saw Delegate Hill first.
Thank you, Madam Chair, and thank you, Mr. Treasurer. It's always a privilege and a pleasure to be in your presence. I'm just curious, since the board or commission had not met since 2005, what have we been doing for the last few years?
My insurance division has been handling it.
So just, they've been handling it without any authority to do so? Or, I mean, what's been, and how have they been handling it?
Hi, Delegate. I'm
Hey.
Laura Addis with the State Treasurer's Office. So for the last 20 or so years, the law has been functioning where for most places where a specific employee is required to be covered by a surety bond, that employee or state agency is taking care of that and obtaining it. What the law says in a lot of places is that the committee that has not been meeting would determine the amount of the bond. But that has not been happening. So the individuals are bonded, but there's not been the oversight from the committee. So what this bill is doing is it's instead saying it would be a bond or an insurance policy in the amount that the treasurer's office would determine.
May I have a follow-up?
Yes.
Thank you.
You're welcome.
So, I mean, I think this sounds like a really good bill. I have no objection to it, but I'm, again, still curious. So have we seen over the last 20 years that as the agencies have been determining for themselves how much to insure state officials for, have we been on the mark, off the mark? Have we gotten into financial trouble because we've underinsured or we've had to pay high claims or settlements or whatever? How have we been doing with this system that had no system?
I spoke with the director of our insurance division to ask that question, and she said in her tenure, which is the last 10 years, there haven't been any claims or any issues of employee or official wrongdoing. So really, thankfully, our public officials and employees are doing the right thing. These are just protections that exist in the event that that would not be the case.
You're welcome. Any other questions? Seeing none, that was easy enough. Thank you very much.
Thank you.
For testifying and coming to see us. You're welcome anytime. This actually concludes the bill hearing on House Bill 1012. Next, we have House Bill 1276, Delegate Wells, and we are joined by Economic Matters, Delegate Shi, Pippi, and Balderrama. And if I may have Delegate Wells, is she here? Oh.
Oh, wait, here she comes.
All right. Will you be so kind and come up with your panel? I believe if you have a panel, that will be great. Okay. Can you bring the virtual witnesses up, please? Thank you. Good afternoon, Delegate. How are you?
I'm wonderful. How are you all doing today?
Good, good.
All right. Chair Pinya Melnick and members of the committee, for the record, I am Delegate Melissa Wells, and I'm here to testify on House Bill 1276, the Maryland Workforce Apprenticeship Utilization Act. As many of you know, registered apprenticeship programs are the on-ramp to construction careers through Earn While You Learn pathways, helping workers achieve family-sustaining wages and retirement benefits. Registered apprenticeship programs offer job seekers immediate employment opportunities that pay sustainable wages and offer advancement along a career path as they complete their training. These programs are the industry gold standard, and they provide contractors with in-demand skilled construction workforce. Establishing and enhancing access to registered apprenticeship programs and the continually expanding infrastructure and clean energy sectors offers opportunity to increase labor participation of non-traditional or underserved groups, including women, people of color, people with disabilities, and veterans. Maryland spends billions in construction, and we should ensure that we leverage these investments to increase access to skilled construction careers and our skilled workforce here in Maryland. This legislation would do exactly that. This legislation would require contractors and subcontractors that employ 4 or more individuals on covered public work projects to use apprentices for 25% of the hours on a project of $250,000 or more. In addition, there is a waiver provision in this legislation that protects contractors and subcontractors who demonstrate a best faith effort in the utilization of apprentices through partnership with registered apprenticeship programs. So for example, if a contractor or sub makes their best effort, not only in the region, but across the state of Maryland to reach out and partner with them, they would be able to get a waiver from the Department of Labor. So while I do believe, as you'll see in the legislation, for the need to have protections in place for those who chronically and willfully underperform these metrics, it is not our intent to be heavy-handed. But we should make sure that we have accountability measures in place for contractors that make no effort to meet this goal or go through the proper channels to request a waiver from the Department of Labor. So I'm happy to work with the opposition on correcting any language that they feel does not meet these goals. And there's more detail that I can also answer about this legislation if you all have questions. I also just would like to end with that, while I do understand that there are some concerns, I have been actively working with the Department of Labor on amendments to this legislation that will give us a product that will help Maryland's apprenticeship programs as well as contractors and subs thrive in this sector. In addition, we are working with the Department of Labor to ensure we are able to keep the state apprenticeship and training fund solvent, as well as lower the fiscal note. Our goal overall is to ensure that contractors access to skilled talent here in Maryland that I know is difficult to find, which you will hear in their following testimony. And with that, I ask for a favorable report on HB 1276. Thank you.
Thank you. Please bring up she's not there. So your panel, I think is Rochelle Ramsey Walker
Yes.
is not on there.
She's not on there. Okay.
No. No.
Oh, what's up? I would have loved for you to have heard from her. She has such a great story about how she got into the apprenticeship program and her advancement, but
Yeah.
unfortunately, she's not there.
It's okay. So we're gonna open it up for questions. Are there any questions, Delegate Lewis?
Thank you, Madam Chair.
My
Thank you for
pleasure.
the bill, Delegate Wells. And considering we're in the same delegation, I only get to see you when we're in each other's committees with our bills. But thank you. This sounds like a great idea. I just want to make sure I understand how the bill works.
Sure.
So it sounds like what it does is remove obstacles to participation in the apprenticeship program. Could you clarify a little bit
Yep.
better?
So what it does is it states that on state funded projects that would be covered under this bill, and specifically for contractors that are employing on that project, they will have at least 4 people on the project. That of the total work hours that they will be completing, 25% of those hours should be done by an apprentice, registered apprentice. And so that can be completed by one apprentice, by multiple apprentices. It does not mean that mean that we have to have 25% of all people on that project, only 25% of hours. And the goal of this legislation is to ensure that I think Maryland has done a great job of expanding access to registered apprenticeships, but the only challenge is that I think there's there's more ways that we can make sure that our funded projects are using them. Currently, the legislation is that if you are on a prevailing wage project and you want to use a registered apprentice, because they are actually a classification and they're able to be paid less, a percentage of the prevailing wage, that they have to be in a registered apprenticeship program. We do not affirm that we should be utilizing apprentices on projects. It's just that if you do use them, which is great, we want that, they have to be in a registered program. So I'm taking this a step ahead. And this is also a best practice that the federal government is really advancing right now under the infrastructure and inflation reduction. This is like one of 4 really key best practices. And I think that Maryland, we're already moving towards it. We should adopt it.
Yes.
For the answer. So a state funded project, for example, might be the rebuilding of the Department of General Legislative Services building.
It could
Or
be.
do we know if there are any apprentices there? Have we lost the opportunity there? And
I don't, that would be Department of Labor might be able to, well, actually the contractors could probably answer that question, but I don't know for a fact yes. Hopefully there are. I hope there are.
My pleasure. Delegate Bagnall, followed by Johnson.
Thank you, Madam Chair, and thank you for this bill. Just for our edification, registered apprenticeships can be union or non-union. Is that correct?
Correct.
I know that we have some opposition in the bill that speaks to this being a pro-labor bill. Have you reached out to the opposition and have they been willing to work with you?
Yep, I've had conversation with them and I was really, I'll be very blunt. I am very pro labor union, right? That's my approach, but I really made sure that this is focused on supporting the industry and supporting expansion of registered apprenticeship. And so I think a lot of I was very careful to really, to kind of take off that hat in some ways and make sure that we're literally just talking about registered apprenticeship, which is what the state has already adopted in terms of our standard and is really pushing it forward. And so anyone can have a registered apprenticeship program in the state of Maryland. You just must simply meet those standards and be registered with the State Department of Labor. So it's agnostic to whether it's union or it's not a union apprenticeship program.
And I asked them to check again because I like to check again and she
Yes.
just came up. So we're gonna call her, okay?
Awesome.
Will you be so kind? Thank you.
There she is.
We have Delegate Valderrama with us today as well. Good afternoon. How are you? Will you be so kind and unmute yourself?
Good afternoon, everyone.
Good afternoon. Give us your testimony. Great to see you.
Thank you for allowing me to speak in this hearing. I won't take up too much of your time, but I do want to express the importance of apprenticeship utilization and how it's truly benefited my life and can have the same positive effect on others who look like me, striving for similar opportunities. For the time that I was 8 years old, I remember being enamored with watching Bob Ross on television with my mother, emulating his paintings. From that, I developed a love for art and wanted to develop my skills as a painter. At the time, there was no knowledge about
Can I ask you
painting.
something? Miss Walker,
Yes.
we're having a hard time hearing you. Let me try something. Can you turn off your video and start again with your testimony?
Yes, ma'am.
And it should be a little better.
Okay. Okay, is this
Let's try
better?
it.
Is this better?
Yes. My
Okay.
son will be very impressed with me. Go ahead.
No problem. So I was just saying from the time that I was 8 years old, I remember being enamored with watching Bob Ross on television with my mother, and emulating his paintings. And from that, I developed a love for art and wanted to develop my skill set as a painter. But at the time, there was no knowledge of opportunities in painting, other than knowing someone in the industry. After many failed attempts of trying to secure opportunities to advance me and my family's lives, I found an apprenticeship program within the unions. During my apprenticeship program, I discovered more times than none, I was the only Black woman or the only woman, whether it being in class or working out in the field. And for me, this stood out as an opportunity, not just for myself to advocate for this industry, to encourage more women to consider these career paths, but the opportunity for, individuals like yourselves, legislators and policymakers, to advocate for apprenticeship utilization. As we all do know, apprenticeships are crucial stepping stones to transforming the workforce, particularly when it comes to supporting women. It empowers them and allows them the ability to achieve their career aspirations, regardless of the norms, that we've all been accustomed to. It allows us also to pave ways to gather, to have the confidence and knowledge for the industries that are typically dominated by men. And if there's any doubt in anyone's mind here that is present today about the success and what it actually looks like in reality, I am that walking testimony, where apprenticeship has taken me from being an aspiring, commercial painter to my current role as an organizer for the International Union of Painters and Allied Trades. And that was only through, the success of apprenticeship, which has allowed me access to good, wages and benefits to sustain me and my family, because without them, I may have been subject to my previous circumstances of buying one meal to last me 1 week, or hopping from profession to profession, looking for that sustainability, or even having multiple jobs at once, just trying to, meet the need. And that unfortunately was never met until I had the opportunity of going through apprenticeship, and having the access to build skill sets that can take me, throughout my lifetime. So I just wanted to lend that, my testimony, as favorable for this bill, because I know the power that it takes, and that it changes lives. It's very transformative.
Well, thank you so much for sharing your journey and your story with us. It really makes a difference, and for making time to be with us today. I'm going to open it up for questions for the sponsor and yourself. And I have the following order: Delegate Johnson, Martinez, Collison, and Shalega.
Thank you, Madam Chair, and thank you for bringing this bill. I like this bill. I just wanted to get your take on a comment in the fiscal summary. It says the bill may reduce the number of bidders and offers on state public work contracts, which may cause the cost of those projects to increase. Give us your take on that.
Yeah, so I mean, in my opinion, it would not reduce the bidders because there's a waiver aspect as well as a fund that folks could pay into if they don't meet it. So it doesn't preclude people from contractors being on these projects. Mhm.
You're welcome. Delegate Martinez, followed by Collison, Vice Chair Collison.
Thank you so much, Madam Chair, and
You're welcome.
thank you, Delegate, for bringing this bill. I think it's so important that we find pathways for all of us in the community to thrive, and I think apprenticeships are how we do that. My question is regarding prevailing wage. I know we spoke about that a little bit earlier. I had a question regarding that, but I wanted to know and making sure that we wanted to align all folks that are on projects with what the current prevailing wages are. Would you be amenable to amendments to make sure that happens for all the apprentices?
Wait, phrase that question one more time. I'm sorry. I think, were you asking about amending the bill to include prevailing wage?
Well, I know you spoke something to the effect that some, I guess, types of work will be classified as the prevailing wage.
So I know there's some interest, and I think this is where the department might be around streamlining it just to apply only to current existing prevailing wage projects. Yeah. And I'm open to that.
Mhm. Vice Chair Collison.
Thank you, Madam Chair, and I too add my thanks for this bill. I am, and I'm sorry if I'm just being obtuse today, but I'm seeing in a letter of opposition something about the Maryland Apprenticeship and Training Program. So how does this bill interact with that, or does it not interact with it?
Yes.
How do we, what's the relationship between
Absolutely
what you're asking for?
So the quick answer is I have to go back and clean that up because I think it was stricken, I think, from the bill, but our intent was not for that fund to go away. Our intent was to enhance kind of what that fund does. And so to the question that Delegate Martinez had, there's bills, there are projects that are not prevailing wage that this apply to, and that those projects also pay into that fund. So we don't want to get rid of this program because it does help expand access to for folks into pre-apprenticeship, which is a critical pathway into registered apprenticeship. So we're going to be working with the agency to make sure that we keep that fund intact. And I know I've talked with some of the opposition about that as well.
Thank you.
You're welcome. Delegate Shalega.
Thank you, Madam Chair. So I have a question about the number of apprentices you're looking for. My husband recently retired after 45 years in the construction industry as a merit shop contractor, general contractor. And we had plenty of apprentices that worked on our job sites. That as in a merit shop, there's no painter apprentice. There's no sheetrock apprentice. There's no insulation installer apprentice. So how are they going to notate these people that work on their job site that are not union are clearly apprenticing? They're learning how to do their trade. So what allowances do you make for that?
So I guess let me go back. So this bill is there are registered apprenticeship programs across various trades that exist that are union affiliated, that are non-union affiliated. So they do exist, they're out there. But this legislation, there are also ways to partner. This legislation is focusing on contractors partnering with registered apprenticeship programs. And so I guess the answer is that they do exist, and that this legislation is simply saying that they should be making partnerships, whether they're union or non-union or, anything. So, and
you don't think they're already doing that? Bill that was passed in 2009
so my bill is very different from that bill. My bill is saying that we need to actually start to create a performance standard, which is at 25% of hours. So for context, that means 100-hour project. We're simply asking that 25 of those hours be completed by a registered apprentice. And it could be one registered apprentice, or it could be several. And I know in my conversations with the Department of Labor, there is a process for folks to be certified. And my understanding is that in most cases, the programs that seek certification, they typically are approved. They typically meet those standards that the state has set for them. So there's a lot of pathways for folks that don't have, that may not have a registered apprenticeship program to have one, on top of there being a host of registered apprenticeship programs across the state that cover various crafts that they can also tap into.
Usually we give homework, Delegate Schley. Okay, any questions? No? All right. Delegate Riley.
Thank you, Madam Chair. Appreciate it. And thank you for this bill.
Thank you.
I definitely has, good intentions. I see that. But currently, pretty much in every industry, we're seeing, a workforce shortage. And Delegate Schlega kind of mentioned on that. Do you think maybe that the bill is a little, I don't know, maybe unreasonable with the percentage or the number of apprenticeships that each job would have on it would maybe encourage, the businesses to get more involved and be more reasonable for the actual businesses, because those people are hard to find.
Yeah.
And I've tried in the past to do some things for like subcontractors, and they are struggling. And I don't want this bill to hurt them in any way. And we want them to, go for the approval. Do you think that would be possible to maybe, come down on the percentage?
I think
of what
that's a conversation that we really should lean on the Department of Labor, because they have their Office of Apprenticeship that really keeps track of this. I've worked closely with them over my tenure that predates my time in the legislature. And typically 25% is, let me be clear, 25% of hours, right? So a more aggressive standard that can be utilized and is utilized is actually like participation, so bodies itself. So ours is one of the most entry level kind of options, and 25% is a pretty low amount. In most cases, contractors really love utilizing apprentices. Not that this is meant to sound predatory, but they are able to provide them a lower wage because they're exchanging the instruction for their time. And they also are making a portion of that prevailing wage, which is what you top out in terms of when you finish your apprenticeship program. So there's cost savings aspects to it, and 25% is a pretty low threshold. And I had conversations with folks to ask like, hey, where is it? What is that? I talked to people across crafts. So like operators were saying, for us, percentage is great because only one person can operate a tower crane. So saying having, 50% of apprentices would mean that they had to have half and half of people. And so you can't really cut people in half, obviously, but you can cut hours worked by apprentices in half.
Sure.
Current programs that we have that we deal with apprenticeships, do we have any data showing, how many that we have that are actually using the apprenticeship program and the businesses that are actually bringing them on board? Do we have good data?
We have data on the number of programs that are open, that are working right now. I know we have data on prevailing wage jobs where if you have a registered apprentice there, I would have to really lean on Department of Labor to give even more context to it, but I know that they do keep really good track of that. And I kind of had some anecdotal conversations over the years with them to see like, where are we as a state? Yeah, absolutely.
Good questions, Delegate. Thank you. Are there any other questions or concerns from HGO? Seeing none, Economic Matters. Seeing none, thank you very much for your testimony today and your patience as we ask these questions.
Absolutely. Thank you.
You're welcome. We have an unfavorable panel, Mr. Thomas Thompson. Good afternoon, sir. How are you?
Great, Madam Chair. How are you?
I'm doing well. Thanks for asking.
Thank you. And for the record, Thomas Thompson on behalf of the Associated Builders and Contractors in opposition to the bill as it's drafted. We have spoken with the sponsor of this bill. We actually share the spirit of the bill. So developing a formulation for utilization of apprentices is something that ABC has been very supportive of throughout the years. And I kind of want to take you in the Wayback Machine to 2009 when this bill was first crafted. it was merit and union laborers that came to the table, the AFL-CIO, the Maryland Minority Contractors, and the Associated Builders and Contractors, and actually established this Maryland Apprenticeship Training Program and Fund. As the bill is drafted, unfortunately, you're taking away the mechanisms to comply with the funds. So right now, you can either participate in a registered apprenticeship program and have them on site. That's the preferable option that we like to see. You can contribute to an organization that has a registered apprenticeship program, or you can contribute to the state's fund, and the state's fund is then used for outreach to people in usually community colleges and high schools to get them interested in the trades. When you look at this bill, it takes those options away and basically says you need to have 25% of your hours dedicated to apprentices on a public works job. That's ambitious. We like the ambition behind that. However, we don't, again, speaking to the data, there's been no study performed to say whether there is a need for that amount or whether we actually have that amount to meet said need. Nationwide, we've seen other utilization programs or utilization figures come out. Washington State is one of them, and they've had problems reaching their numbers, unfortunately. And so I think there is a way that we can work with the sponsor, work with the Department of Labor, and find a way to get apprenticeships on the job. Look, this is how you get people, family sustaining wages, not just simply minimum wage. These are family sustaining wages with great benefits and perks to them. So we will continue to work with the sponsor in this committee to find that reasonable middle ground on this legislation.
And I want to thank you on behalf of the committee and the sponsor for sitting down and working it out. You both are here. If you could do that when you're done, exchange information, continue, that would be great.
Yeah, we've already spoken, and we'll keep talking.
That's wonderful. Are there any questions? Seeing none, I just want to say thank you and thank you for your willingness. Okay, we really appreciate it.
Thank you, Madam
Hope you
Chair.
have a blessed day.
You too.
And thank you. This actually concludes the bill hearing on House Bill 1276. I want to thank the Economic Matters Committee colleagues. Thank you for being patient, okay? And you're welcome anytime. Anytime, come over. We have next House Bill 464, and I want to thank the committee also for your patience. We have Delegate Martinez next, Health Occupations Practice Audiology Definition. Delegate Martinez, will you please come up with, I believe is Mr. Glenn, Dr. Brianna Holton, Dr. Melissa Segrib, and Dr. Alicia Spoor. They're actually your sponsor panel, I was told. And whoever else you want to bring up, they can bring the chairs and move them up.
All righty. Thank you. We're moving chairs so we can get
Yeah,
everybody.
bring the chairs up.
Also
Nice
my
and cozy.
Thank you. And also my staff is passing out an appendix that I'll be referencing. So we didn't have time to get it uploaded to the floor system, but we wanted to make sure you guys had it because it is critical in the
You
discussion.
should go through the back, please, like behind us, please, because the cameras are here.
Yes.
Excuse me. You
Go
can
behind
come
them.
through the behind us because the cameras are there. Thank you. Go ahead.
Thank you so much,
Oh, you're
Madam Chair.
welcome.
Madam Chair and colleagues, for the record, I am Delegate Ashanti Martinez, here to present House Bill 464, Audiology Practice Definition. I want to first start by thanking all of you for your support last year when we gave the audiologist authority to prescribe and order hearing aids as required by the Food and Drug Administration's final rule. That common sense proposal wasn't without a fight. In last year's bill, we had the words diagnose, manage, and treat auditory and balance conditions in the ear as part of the new language. But due to objections from the same individuals who are in opposition this year, and in the spirit of compromise, those words were struck to pass last year's bill as it basically legally was mandated, notwithstanding the strong evidence that we will present today to pass this year's bill and why these words belong in the statute. So why are we here asking for these words and other essential healthcare provisions that directly relate to the training and competency of audiologists to be inserted in the practice audiology statute? Well, the answer begins with the fact that it's been 20 plus years since the basic audiology statute was written, and the science of audiology and the technologies related to audiology has changed. We want to do two things. First, modernize the audiology statute to reflect those medical technology advances to benefit patients. And secondly, harmonize the audiology statute with other similar health occupation statutes in Maryland and in other states. I have provided an appendix with those statutes and regulatory references to my testimony, and that was what was just passed out to you all. And the normal concerns of perceived scope battles that this committee hears, you should ask yourself, why should a profession which is capable of providing audiological medical services to the fullest capabilities of their education and training be prohibited from doing so? Our goal here is to provide the most affordable and skilled healthcare with timely access to our constituents. I want to emphasize the affordable and skilled and timely access aspects as you listen to the testimony. You will directly why patients need the audiologist to order certain procedures, not just perform, but order these procedures. You will hear about the misdiagnosis of a tumor by an ear, nose, and throat physician that was suspected by the audiologist and could have been confirmed and treated years earlier if the doctor of audiology could have ordered imaging. You will also hear from an audiologist about how her patients are being told they have to wait 5 weeks to see a nose, ear, and throat physician when they need immediate care. The opposition will profess that they would take the patient earlier if called, but they were called. And if you put yourself in the patient's shoes, being told to wait 5 weeks because you are in a heavy populated area or the specialized surgeon only visits your rural community office once a week is not only frustrating, it's downright infuriating. The ever-increasing physician shortage affects patient affordability and clearly impacts timely accessibility. Appended to my testimony is also detailed and extensive documents that support and justifies every word in this bill and supports the modernization of the audiology statute and unarguably harmonizes the statute with other healthcare occupational statutes in Maryland. Specifically, the words diagnose, manage, and treat are used to and are in the optometry, podiatry, chiropractor, and dentistry statutes and are cited in the appendix. Are the opponents challenging the statutory approval of those words in those statutes? I haven't seen legislation to that effect. And if they're not actively trying to limit those doctors' services, why are they here to oppose doctors of audiology? More specifically to the bill, healthcare screenings are part of the Academy of Doctors of Audiology's licensure requirements and referenced in the appendix with other sources. Removal of a foreign body or earwax from the external ear is absolutely supported by the medical training of these licensed audiologists, but is being restricted in their practice by the proposed MSO amendments. The ordering of blood work is also cited in the appendix as part of the American Speech Language and Hearing Association Council of Academic Accreditation treatment standards required in a Doctor of Audiology program. The proposed MSO amendments strike for which audiologists are trained to order blood work. It's flat out a denial to the right of practice the full scope of their licensure and the detriment to our constituents. As part of a medical team, especially with bone-anchored hearing aids and other implants, radiographic imaging is required prior to the surgical procedure. The MSO amendment would increase costs to patients by requiring more appointments to the ear, nose, and throat surgeon. This amendment would require the patient to have at least one additional visit to the ear, nose, and throat surgeon to simply obtain a paper referral to the radiology center. This also results in the patient being billed for an additional office visit from the ear, nose, and throat surgeon, rather than allowing the audiologist to directly provide the imaging referral at the original diagnostic appointment. All of this is required before the surgery to be scheduled. This is a common but unnecessary barrier in the audiology profession, affecting the patient's affordability and timely access to healthcare. So, members of this committee, I appreciate your attention to this important bill to modernize the audiology statute and to harmonize it with other health occupation statutes and other statutes in other states. I respectfully request a favorable report on House Bill 464. Thank you.
You're welcome. Excellent job. Who's next?
Thank you, Madam Chair, distinguished members of the committee, Gil Jen on behalf of the MAA. The Board of Examiners is the licensing authority for audiologists in the state, and they unanimously support this bill as written. If there were a concern about audiologist training and competency, they would have said so. The MSO opposition letter says in the bill, use any means known in the science of audiology is too broad. Really? Let's look at the optometry statute. Optometry means to use any means known in the science of optics and eye care. Sound familiar? MSO inserts the words non-medical to modify, evaluate, treat, diagnose, and manage conditions in the ear. The two accrediting doctoral program bodies in the ACAE Standards for Doctor of Audiology and the ASHA CCC certification that the opposition letters put in their signature block state students will be able to diagnose, triage, treat, manage auditory and vestibular balance conditions and diseases for patients, and prescribe, perform, and interpret clinical, laboratory, and other diagnostic procedures and tests. In the letters of opposition, the ENT employed audiologists probably all admitted to medical malpractice when they stated, I am not trained to make a medical diagnosis of a disorder or condition of the ear. That is exactly the standards that are required here. Maybe the Board of Examiners should be reviewing the qualifications of audiologists that work with ENTs. The non-medical amendment would change the statute and force patients to pay privately for services that are currently covered. The audiologist would then be unable to meet the medical necessity requirement for insurance coverage. We will present compelling testimony, what that means to your constituent, and why the MSO amendments are a barrier to timely access, increased cost to your patients, and increase unnecessary visits to the ENT offices. We urge a clean, favorable report. Thank you.
Thank you. Next, please.
Madam Chair and committee members, my name is Dr. Melissa Segev, and I am in full support of HB 464. I'm a doctor of audiology and private practice co-owner with 10 locations in Maryland. I have been practicing audiology for 15 years, and I love being able to improve the quality of life for so many Maryland residents, but I can do more. Ordering, not interpreting, lab work and radiographic imaging for patients can provide insight into other health disorders that cause hearing loss, tinnitus, and dizziness, such as autoimmune disorders, diabetes, heart problems, neuropathy, infections, medications, metabolic and hormonal disorders, vitamin deficiencies, infections, medications, etc. Certain medications are ototoxic, and that means they can cause hearing loss and dizziness. Monitoring blood levels for these patients is important, as a dosage and duration can be adjusted to limit further damage. The biggest concern as audiologists are acoustic neuromas. They are benign tumors that grow on cranial nerve 8. An MRI is the only way to confirm this. However, audiologic testing can suggest a tumor is present. If a tumor is present, that patient is referred to a neurotologist, a special physician who treats acoustic neuromas. Local ENT doctors, especially in rural areas, do not treat tumors. I have 2 offices in rural areas where patients drive over an hour to see our providers, and I truly believe they wouldn't seek treatment if they had to do further. MSO feels audiologists are unable to perform health screenings without training. MSO feels we need to check in with the board to demonstrate proof of training when treating patients. And MSO feels we need to refer a patient with auditory and vestibular dysfunction to a physician, physician assistant, or nurse practitioner, rather than manage these patients ourselves. MSO should stop feeling what audiologists can't do and focus what is in our education and scope to help Maryland constituents. Our 2 accrediting bodies show we can manage, evaluate, diagnose, and treat auditory and vestibular conditions. Both a physician assistant and nurse practitioner have less education and clinical training than us. Furthermore, this will increase patient costs. It appears MSO is so focused on disputing the science of audiology and disrespecting our profession, they ignore the purpose of the bill. This bill is about the patients, giving them the ability to be managed and educated by qualified doctors of audiology. I ask for a favorable report on House Bill 464.
Next, please. Thank you.
My name's Dr. Brianna Holton, here on the behalf of the Maryland Academy of Audiology in support of House Bill 464. I've been a licensed practicing audiologist in Maryland for over 26 years and co-own an audiology private practice with 10 office locations in Maryland and including the Eastern Shore. Our 11 doctors of audiology screen, evaluate, diagnose, manage, and treat hearing and balance disorders to patients of all ages. The MSO is creating more barriers to the screening proposal. We all know that prevention is the best care, so it is critical that there are no more barriers to health screenings. A variety of self-service health screeners are located online and in public shopping centers, yet MSO feels licensed doctors of audiology cannot perform screenings without further training. This simply doesn't make sense. Medicare requires eligible audiologists to complete screenings and ask about depression and abuse to adult patients. We administer cognitive function and falls risk screenings on an almost daily basis. Allowing audiologists to complete screenings does not introduce any more harm than a screening that an individual completes themselves at Walmart. The amendment from MSO regarding cerumen, otherwise known as earwax, is redundant. Audiologists safely clean ears daily using magnifiers and light sources and is already part of our regulations and simply needs to be codified. Cerumen and other foreign bodies such as Q-tip cotton, hearing aid domes, and filters are removed from the ear canal often. Everybody cleans their own ears using a variety of hazardous objects, as evidenced by YouTube and TikTok. Micro-instrumentations can even be purchased online. Yet MSO is suggesting that licensed doctors of audiologists cannot use micro-instrumentation that we have been using for years to safely clean our patients' ears. Again, this doesn't make any sense. Thank you for your consideration. We ask for a favorable committee report on HB 464.
Thank you. Who's next, please?
Madam Chair and committee members, my name is Dr. Alicia Spohr, and I'm a Mayo Clinic trained audiologist practicing in Howard County. I'm here requesting audiologists be able to practice their full didactic education and clinical training as other clinical doctors do. The audiology statute already allows audiologists to evaluate hearing and balance disorders. Diagnose, assessment, and evaluation are listed in the audiology COMAR regulations. HB 464 simply codifies the language to prevent any ambiguity. The Veterans Administration uses the words diagnosis and treatment describing audiologists. A study from Mayo Clinic, Florida suggested the safety of direct audiologic care, and Johns Hopkins references a diagnostic hearing test completed with an audiologist on their own over-the-counter hearing aid website. The MSO amendment to remove this language is restricting patient access. This would be detrimental given the shortage of providers, especially in rural areas. As you heard from Delegate Martinez, last year's legislation codified the audiologist's ability to prescribe and order hearing aids, which treat hearing loss. The practice of audiology needs to clearly manage and treat, which is why audiologists would prescribe and order hearing aids. The MSO amendment to remove manage and treat would not allow audiologists to manage and even refer their patients to physicians, treat balance disorders with positioning techniques, treat ringing in the ears with FDA-approved tinnitus stimulators, or supplement hearing aids with communication training. The MSO introduction reports more than 300 Maryland ENT providers. It does not state how many treat ear disorders or the insurances they accept. By not allowing audiologists to manage and refer to appropriate providers, which often include dentists, physical therapists, and dermatologists, it puts a strain on the healthcare system. The audiology statute needs to be modernized to codify the language and regulations and accurately reflect the level of didactic and clinical training. I ask for a favorable report on HB 464.
Thank you for your service and your testimony. Who's next, please?
Madam Chair and committee members, I'm Dr. Jana Brown, and I'm testifying today as a licensed doctor of audiology from Western Maryland, not as a current member of our Board of Examiners. In 2007, I saw a 32-year-old female patient for a hearing test that was recommended by an ENT. After completing her history and diagnostic evaluations, I was convinced she had an acoustic tumor in her right ear. I advised her to get an MRI. Her ENT refused, which I found out when the ENT sent her back to me over 8 months later. She had now lost all hearing in that right ear. After finally obtaining the MRI, the acoustic tumor was confirmed and she had surgery at Johns Hopkins. 2 years later, I was sued by this patient for 2 reasons. One, she thought the ENT was my employee. They were not. Secondly, because I had not ordered an MRI. Since I couldn't order imaging, my hands were tied, and the best I could do was beg her physician to order the scan. Had I been able to place the order for imaging, this patient's outcome may have been very different.
In 41 years of practicing audiology, I've recommended imaging to many patients and advised them to contact me if their ENT refused to place the order. I would then discuss it with their ENT or their primary care physician so they could get the care and imaging they needed. Ordering imaging will not preclude will not preclude us from making appropriate referrals back to the physician. The audiologists that are opposed to this definition change are all employed in ENT settings. They have no real need to order imaging or blood work as the patient is seen by the ENT immediately following the hearing test. Garrett County has access to ENT services 1 day per month. Allowing audiologists to order imaging will reduce wait times for appointments and reduce repeat office visits for patients. It'll also reduce healthcare costs, reduce the demand on ENT schedules, and most importantly, provide better outcomes in healthcare for the patient. I urge your favorable report on House Bill 464. Thank you very much.
You're welcome, and thank you all for your work in our state. I'm going to open it up now for questions from our committee. I'm going to look to my right. I'm going to look to my left. Delegate Bagno. Usually I forget the right, so.
Thank you, Madam Chair.
Figure if I remind myself loud enough and I can hear myself, I'll do it right. Go ahead.
Well, I will start with saying I am not a doctor and I don't play one in this committee. And I really appreciate modernization bills. That said, as a true believer of care coordination, I loathe bills where qualified specialized professionals come and malign each other. So I'm hoping that that won't be where this goes. So I think this question is to Dr. Spoor, because you spoke to the fact that this modernization and also that the opposition spoke to evaluate, diagnose, manage, and treat that they wanted to amend it because it's reserved for a higher level of education and training. So can you explain what this higher level of education and training is?
I'm happy to attempt to explain what the higher level of education is. So thank you for that question. As a clinical doctor of audiology, just like our other clinical doctors, optometry, podiatry, chiropractic, dentistry, as you heard some of my colleagues say, we all have a 4-year post-bachelor clinical doctoring education. Within that process, we're doing not only didactic training in that either 3 or 4 year coursework, but also a significant number of clinical hours, usually more than 1,800. And I stopped counting at 2,500 when I was in my clinical rotations because it was a waste of paper for me to write down all those extra hours when I had meet that requirement. The difference between a clinical doctor and a higher level of education, there isn't one. We already have a clinical doctor at work. So the higher level of education would simply be the physician, MDs, or DOs. And so as you heard one of my colleagues, I think Dr. Segev mentioned, oftentimes we have more education than the physician assistants that sometimes work with our primary care colleagues. We often have more education and specialized training within the ear, hearing, and balance than often those nurse practitioners. And so what the term, higher level of education between a clinical doctor and an MD would be, I would love to know from my colleagues when they come up as well, what they think that intermediate step is. But hopefully that answered your question.
You're welcome. I have Delegate White Holland next.
Okay, thank you, Madam Chair, and thank you, Delegate, for bringing this bill and for the panelists. From your testimony, the way that I understand it is that it would allow an audiologist to practice at the top of their license, right? And it was mentioned in testimony that it would essentially codify what already exists into COMAR, which makes me wonder the concern, right? And I appreciate you sharing some of these documents and appendices. But I'm curious to know how this has potentially played out in other states where this, or if it has been considered elsewhere, and what essentially makes Maryland different in this instance. Who's ever best to answer?
Yeah. I don't want to.
No, 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 no.
Yeah.
You're the doctor.
So if you look through the appendix that I think Delegate Martinez staff passed out to you, you'll see a variety of other states, and I don't count all of them off the top of my head, that actually use the words diagnose, manage, and treat. And we know that Alabama is one of them that uses all three of them. We know that Colorado uses that language, Illinois uses that language as well. So Maryland is not the first to put these into our language, but it is one that we want to make sure, because we want to make sure that we are on par with the other states that are doing this, because as a practitioner in Maryland, and I know you see patients from West Virginia too, I want to be in more of the top of that care and audiologic care and training and not in the bottom part of it. But we also know that none of those states in our due diligence bringing this forward with the delegate, we also went back to those states and said, hey, if you're using the word diagnose, how many audiologists are being reported to a board of examiners as either misdiagnosed or some type of patient safety issue? And there were no complaints that we could find around these different pieces of language. So not only are they being used in other states, they're being used appropriately, and the audiologists are working within that practice to provide that level of care and safety to the patients, which I know is always the end goal of making sure that your constituents are safe. Did that answer your question?
Sure. Very quickly, I know that you referenced, the appendix here. Could you provide, and maybe this is for the delegate, if you could tell me where exactly
Yeah.
that is, so I can better
So,
direct my attention.
No, I was luckily looking to make sure I knew exactly where that was. So it starts on page 2 of 14. If you look at the bottom, the word diagnose is mirrored in these other states, and it starts listing the states, and then it lists other for manage as well as treat, and the sources of those states that have that language in their statutes. Yeah, of course.
You're welcome. I have it in this order: Delegate Rosenberg, followed by Vice Chair Collison, followed by Delegate Hill.
What's the status of the discussions, if any, you're having with the doctors about this legislation and possible consensus?
Yeah, last meeting my office had was on Friday. So we're still very much in discussion. I know what their amendments basically strike the intent and purpose of why we're trying to do the bill. I know in some testimony, you'll see the opposition feels like this isn't the year for this, and there's a lot more work to be done. I think this is the year for this, and I think we have a good bill as is.
May I, Madam Chair?
Yes.
If you have a good bill as is, what's the purpose of the negotiations?
I mean, I think if their amendments were amenable to be something much more reasonable than striking what we're trying to do, we would be willing to have those conversations. We're always open to have conversations, which is why we had one the Friday before the hearing. But I think talking to folks even in the hallway today, it's very clear that we just might end up on separate sides of this. But I think this is a solid piece of legislation, and I do think what the audiologists are asking for isn't unreasonable.
You're welcome. Vice Chair Collison, followed by Delegate Hill.
Thank you, Madam Chair. and Thank you, delegates and panel. If you don't know this now, if you can get it for me or for the committee, where are audiologists practicing now in Maryland? And what are the numbers across the state? So if you could get that for me, that would be really helpful.
Absolutely.
Unless you have it already.
I don't know if any of the panelists have it. I don't have it personally, but I can make sure to get it to everyone.
Okay, thank you.
Delegate Hill.
Thank you, Madam Chair.
You're welcome.
Thank you, Delegate, for this bill. I'm just trying to wrap my head around what is the issue that you guys are at loggerheads over. So I make an analogy if I can. So in my profession, when I work with physical therapists, occupational therapists, sometimes, I'll write a order and I'll say, need you to evaluate and treat. And then they'll evaluate and treat. And then they'll come back and say, we think this needs to be done. And I'll say, sounds good, or it doesn't sound good. And sometimes I'll just say, evaluate and treat as you deem appropriate. You got it. You don't have to check with me. We're heading for the same goals. Is this what this is about? That you feel like the current statute requires that you have to get everything that you do approved? And that you're saying that you shouldn't have to do that since you're the experts on hearing imbalance treatments and evaluation, that once the patient is your patient, unless it's requiring surgery or some other intervention or medication change or something, because nothing that I read in your bill is saying we want to prescribe medications or do anything else. It's saying that we want to be able to evaluate and then move on. So what does moving on look like? When you say treat, what does that mean other than prescribing a hearing aid or auditory therapy, or can you help us understand what is the breadth of a treatment that you would do that without this bill, you'd have to keep checking back with some physician to get approval for?
Sure. Do you want to answer that?
I'll start. You can
Okay.
finish. Thank you for the question. It's a wonderful question. And I will tell you that audiologists love it when we get orders that say eval and treat. And part of our concern is if evaluation, management, diagnosis and treatment isn't codified, how are we supposed to evaluate and treat? Are we allowed to do a hearing test then, which is going to result in a diagnosis of hearing loss of some type or normal hearing? Also, as far as treatment goes, hearing aids, we're not curing, we're not healing, we're treating hearing loss with amplification or a cochlear implant or a bone anchored hearing aid. And treatment for vestibular patients, for balance patients, can be what we call repositioning maneuvers for vertigo and things like that. And if these things aren't codified, are we going to be allowed to do that? Medicare, and I'm not going to have the right letters here, but Medicare pays us for performing hearing evaluations. And if we're not allowed to evaluate and treat, Medicare would not reimburse us as long as we, of course, have medical necessity. We have to have medical necessity before we can test, diagnose and treat. So the fact that we can be reimbursed by insurance companies after being credentialed and all this, and with our education, treatment means prescribing amplification, treating balance disorders, oral rehabilitation, repositioning maneuvers, things like that. Does that?
Okay. And I'll be asking the other panel the same question. So to the example you gave of the patient with the acoustic neuroma that was missed, if you'd been able to order a CAT scan, there still would have been a need to communicate something. So what would have been different, all right? Or what you're ordering tests without knowledge of what other tests happen. I'm still trying to figure out why there's no coordination, or why in 2007 there was no coordination. I don't think you need a bill to say I can order a test. What tests are you ordering that you wouldn't just say?
Well, right now we are not permitted to order imaging. They're saying it's not within our scope. When I saw this patient, the test results suggested to me that there was a tumor in one ear. And because I could not order imaging, the patient was supposed to go back to the ENT, which she did. The ENT thought she had another disorder, a middle ear disorder, which the testing did not support. Yeah.
You have been, in other words, it seems like for whatever reason, they were in a different part of the state or wherever, there was just a communications issue that to say, Dr. Hill, you got, Ms. Shalega here, and I really think she has this disorder, and I'd like her to get a CAT scan. I need you to order that.
Which is what I did.
Right. Okay. So that's going to happen.
Right.
I mean, so even if you can order the test, it doesn't make Dr. Hill pay attention to the test you order or do anything. And so your other option, of course, to say to the patient, you need to see another doctor because you've got a problem and this needs to be addressed.
Right.
So I'm not sure that you're being able to order the test. You talked about it making things faster and all that kind of stuff. If the communications isn't there, or the physician who then has to do the next thing, because you could always refer them on to someone else. You could have said, right? Here's the neuro-otologist that we work with.
Right.
This may be who you need to see instead.
Right.
So I'm not clear how this changes the absurdity of that situation.
Well, if I could have ordered the MRI, the patient would have had that test in her hands when she went back to the referring physician. And therefore it would have showed the tumor was present on that scan, which then hopefully that physician would have carried through with making a referral to a neuro-otologist for proper treatment. The fact that she didn't order it, had I known it wasn't ordered long before I saw her, because she was supposed to come back to my office and she failed to do that, was part of the issue. But we could have gotten her to the physician sooner when the tumor was smaller, because obviously it had enlarged because the hearing had changed dramatically and her balance was affected. So as a result, it could have really sped up her treatment, which could have been more successful than it ended up being.
One final one, and that's it.
In-office non-radiographic scanning or imaging study. So we know what MRIs are and CAT scans. What are the non-radiographic scanning or imaging studies that would be ordered?
Sure. I love that question. So thank you. Basically, non-radiographic imaging or scanning are just what you hear. They are the modernization of tools that we have had within the profession of audiology for the last 50 years, but now we can do it digitally through either imaging, scanning, etc. So I'm going to give you an analogy and then I'll tell you what it is in audiology. When you go to the optometrist and they say, well, I can either dilate your eyes and you can't see your drive, or I can do the retina scan and take that picture. That's an in-office non-radiographic image. We have the exact same thing in audiology. So we have our video otoscopy, which lets us take pictures of the ear canal and the eardrum. We have our 3D ear scanners that, rather than putting giant putty and having it sit in your ear for 10 minutes to take an ear mold impression for hearing aids or hearing protection, we have 3D scanners that will do that now. We have other, type of imaging processes that we can use. That's just modern technology. So we wanted to make sure when we were working with the delegate that there was no ambiguity when we put this legislation forward. And so that was one of the reasons why we put in that clause of non-radiographic in-office imaging and scanning. And again, that's just the modernization of the equipment that we're able to use. You're welcome.
Oh, you're welcome. I think that is it for questions for this panel. Thank you very much. This was very thorough. Thank you for your questions. Next, we're going to call an unfavorable panel, and that is Shannon Pryor, Dwayne Taylor, Daniel Shudock, Barbara Brocato, and will you be so kind, bring up James Deneni, and that will be the last witness, the virtual one, and then Vice Chair Bartlett. We will be with you after this bill, okay? Thank you for your patience. And good afternoon, everyone. And feel free to, if I called you, bring up a chair, please, and join. And I actually called Shannon Pryor, Dwayne Taylor, Daniel Shudock, Barbara Brocato, and then I have James Deneni. Who would like to get started?
Madam Chair, members of the committee, Barbara Brocato, here on behalf of the Maryland Society of Otolaryngology and in opposition to House Bill 464. I just want to start by saying that this bill came as a surprise to us. This is a bill that totally redefines the practice of audiology in the very broadest terms. And as you've heard from the proponents, audiologists and otolaryngologists work as partners, as a team. And we didn't have an opportunity to work together in the development of this legislation. I will say, once the bill was introduced, we had a meeting with the proponents, and at their request, we searched other states, reviewed the health occupations article, and in the best way possible, came back with an effort with some amendments. Those amendments were not distributed today. Nobody ever got back to us in terms of the reaction to the amendments. The first time we heard the reaction was today here in the hearing. So I just want to say that the redefinition of this bill just leaves open to question exactly what an audiologist can and can't do. And when you look at other health occupations, if they use the term diagnose, treat, manage, they have specificity around it. When we reached other statutes that we looked at recently, that were recently enacted, there was a lot of specificity. We looked at North Carolina statute, and we looked at other statutes across the country. We want the committee also to know that, yes, you have affidavits from otolaryngologists across the state that in an urgent situation, they will see patients within 24 hours. You have letters from audiologists who said, we are not trained to diagnose and treat conditions of the ear. Thank you, Madam Chair.
Thank you. Next, please.
Thank you. I'm Shannon Pryor. I'm an ear, nose, and throat physician from Chevy Chase, and I specialize in ears. I'm also a past president of MedChi. I urge you to vote no on HB 464, which would put my patients at risk. This bill would allow audiologists to practice medicine in the state of Maryland, and audiologists are not trained to practice medicine. Current code says the diagnosis, treatment, and management of physical, mental, or emotional ailments constitute the practice of medicine. This bill would make the practice audiology synonymous with the practice of medicine with regard to the human ear and relegate medical care of patients to those without the medical and surgical training necessary to provide safe, effective, and comprehensive medical care. While the existing definition of the practice of audiology is relatively specific, the proposed terms are broad and vague. The language that allows audiologists to practice any means known in the science of audiology to diagnose and treat ear disorders would open the door to audiologists providing medical care that they're not trained to provide, and this will endanger patients. Patients need access not to any care, but to quality medical care by experienced individuals who have been fully trained. I work with audiologists. They're important members of the team. When there's a possible medical problem, they refer the patient to a physician for appropriate medical diagnosis and treatment. And when it's urgent or emergent, we do see that patient promptly. This bill is dangerous to patient safety, and it's too flawed to be wordsmithed. There is no need or urgency to change the definition of audiology as currently written. We've reached out to the proponents to discuss more appropriate language that would protect the safety of our patients. Please vote no on this bill and allow the stakeholders to seek an agreement between sessions that would protect patient safety. Thank you.
Thank you. Who's next, please?
My name is Dr. Dwayne Taylor, and Madam Chair, Madam Vice Chair, and members of the Health and Government Operations Committee, I appreciate the opportunity to testify. I'm a board certified ear, nose, and throat physician, otolaryngologist, head and neck surgeon, and I've been in practice over 30 years in the state of Maryland, and I practiced in both Montgomery County and Prince George's County. During that time, I've served as a past president of our national organization, the American Academy of Otolaryngology, Head and Neck Surgery, and as past president of the Montgomery County Medical Society, as well as on the Health Commission for Montgomery County. I am a passionate advocate for the quality and safety of our patients inside and outside of my specialty, and for our physicians inside and outside of my specialty, and particularly those patients who have barriers to access to care. I'm here to speak in opposition to this bill regarding the scope of practice for audiologists in the state of Maryland, because at its core, it leaves open the door for possible gaps in that care when the appropriate providers, in this case, ENT physicians, are not a part of that decision-making process. My awareness of the content and asks of the Bill 464 and the scope of practice concerns are not new. And as I've said, I've been involved in this sort of discussion on many occasions and in many, both local and on a national level. in a solo practice in Bethesda, Maryland. I've worked with audiologists in settings, and I've worked in settings where I refer my patients to audiologists, and we work collaboratively. It's really important, and when you look at the language of this bill that talks about the practice of audiology and the phrase, the use of any means in the science of audiology, that this is broad and vague language that doesn't speak to validate acceptable standards of care. Evaluate, diagnose, and manage and treat as roles now for the practice of audiology are areas of concern. Thank you.
Thank you, and thank you both for your practice. Next, please.
Sure, Madam Chair, members of the committee, I'll be brief. You've heard from the physicians. I just want to echo the concern around the language. So much matters around the words on the page, and we've done our due diligence. We've been researching other states and looking at practice acts across the country and even here in the state of Maryland. And the one resounding return is that when those words diagnose, treat are used or any means known, there's qualifiers around that, particularly each specialty. And to the point that was raised by the earlier panel, we're not going to speak to the dentistry and optometry and the podiatry. That's not what these physicians do. So we're here now to try and work through the bill and come up with the right language that makes it clear what the roles are and what is ultimately best for the patient. So thank you very much.
Thank you so much. We do have a virtual witness, and I'm going to allow it and then open it up for questions, okay? Sir, will you be so kind and unmute yourself and give us your testimony?
Thank you very much, Madam Chair.
You're welcome.
Good afternoon. I'd like to thank the committee for the opportunity to testify today in opposition to HB 464. I'm Jim Denaney. I've been an otolaryngologist for over 40 years. I am a clinical professor of otolaryngology at Johns Hopkins School of Medicine and currently the Executive Vice President and CEO of the American Academy of Otolaryngology and Head and Neck Surgery. And I will be speaking on their behalf today, as well as having submitted written testimony to the committee. This legislation, if passed as written, would result in a significant expansion of the scope of practice of audiologists. Parameters of practice should be defined by training, assessment of competence, licensure, and privileging, and should not be legislated. This bill describes the practice of audiology to include the ability to order, evaluate, diagnose, manage, or treat any auditory or vestibular condition in the human ear. The wording of this legislation would allow audiologists to make medical diagnosis, to order non-auditory, non-vestibular testing, write prescriptions, perform surgeries, none of which fall within the training or of their licensure. The most egregious examples in this bill include prescribing a sound processor for patients with implantable hearing devices without consultation of the operating surgeon, the conducting of health screenings not limited to the hearing or balance systems, removal of any foreign body from an ear canal, including children, the ordering of cultures and blood work testing without prescribing rights, and the ordering of radiographic imaging. We urge the members of the Health and Government Operations Committee to defeat this unprecedented attempt to provide requested medical privileges to audiologists under their current training paradigm. Thank you very much.
And thank you for your patience as we heard from the other witnesses. I'm going to open it up now for questions from the committee. To my left, are there any questions? Seeing none. To my right, yes. I did before, I started to the right. Okay, so Delegate Kaiser, followed by Kipke.
Thank you, Madam Chair, and hello to my constituent, Dr. Taylor. I wanted to understand what are some health conditions or underlying conditions that you think could be easily overlooked as a simple corrective hearing issue that would require someone with more training?
Well, one of the things actually was mentioned in those who were in favor of this, which has to do with things like ear infections of the ear, also hearing loss. It could be an idiopathic sensorineural hearing loss, a sudden hearing loss. And it's very critical that we are integrally involved in that process. Many times patients may come to them initially, and if they take on the medical perspective of trying to diagnose why someone has this loss without being able to look at all the factors that go into it, like we get in medical school as well as in our medical training, then there's a much greater chance that they may miss some of these particular issues. So, and we can all give anecdotal situations where patients had hearing aids put on because they went straight to an audiologist and never knew they had a tumor there for 8 years. That's really not the point of this. We want to collaborate with the audiologist, but we don't want to expand their scope that's not in alignment with their training. And that's the critical piece, is they're not trained to be medical doctors that are specialized in our area.
Delegate Kipke, followed by Delegate Hutchinson.
Close enough question to mine, but got an answer. Thank you.
Thank you. Delegate Hutchinson.
Thank you, Madam Chair.
You're welcome.
Probably Barbara's the right one to answer this, just because you represent the whole group. And this is a committee of like compromise and trying to work things through healthcare shortage. We've seen a lot of scope bills last year. We're seeing them this year. I am going to be bringing one up myself. Do you see a solution here, though? Do you see a potential outcome? And what would that be?
Well, thank you, Delegate Hutchinson. Thank you so much for that question. If there is goodwill to sit down and really look at what the obstacles are and how we can jointly address those and change the statute, but change the statute in a way that there's not such ambiguity that it's hard, as the physicians here have said, there's no difference between defining the practice of medicine and the audiologist's definition here. And that's what is unacceptable from our point of view. That's why, even though this is a bill that I would have liked to have seen brought to the attention of the MSO in June and say, we're going to bring a bill in the 2024 session. Yeah. Okay. And we are, we want to try and work it out because we know that's what the Health and Government Operations Committee wants, what the Senate Finance wants, and what the General Assembly wants. And that's how we want to work. So it needs goodwill. It needs willingness to really say what is done and not done with the physicians and the audiologists that are doing this, that are treating these patients in a safe way.
I know the delegate personally that introduced this bill. I know he has a lot of goodwill. I would say that of everyone here. So I would ask you, it's not June, but if you could sit down because he has a lot of goodwill, okay? That would be great. Excuse me?
Can I speak to that goodwill?
Did I open a can of worms? Go ahead.
No, I do appreciate the opponents of the bill. Our offices have been meeting since the beginning of this month. Let me speak in the mic. So our offices have been meeting with you and trying to set up meetings since the beginning of this month. So I want to make sure that you understand we are willing to talk and have conversation, but let's not impugn what my motives or goodwill is. We are willing to work on this, and we have been, and we encouraged by the testimony today, and we look forward to having a product that we both can be proud of.
Okay. And better yet, when this is done, and it'll be done really fast, I would encourage the delegate Martinez from the 22nd district, and he's gonna get up and you're gonna join him outside and you will make an appointment to talk, okay? So I have Delegate Bagnell next.
Thank you, Madam Chair. And this is just a clarifying question because, we heard from the audiologist, we heard from the otolaryngologist. Oh, I tried so many times. But Dr. Taylor, The ENTs, Dr. Taylor, I'm looking at, I heard you speak to your specialty on head and neck. I'm looking at your website and it speaks to nose and throat but when I'm looking at the definition of the ENTs, it does speak to issues of the ear. What is the nexus between these two specialties? So that we can understand like where the concerns
Right.
are, where the outlying concerns are, because it seems like the audiologists are the specialists in the ear. So help us understand what the concern is.
Okay, well, I appreciate you asking that question. Let's take it to its most basic level. We are medical doctors. Medicine is both a science and an art. The decisions that we make are based on our training, okay? The audiologist we work in collaboration with in order to get diagnostic testing, in order to do certain rehabilitative treatments that are needed. We dialogue as far as what's going on with our patients. We're part of the team when we engage them, okay? But in no way have they been from a training standpoint or from a practicing standpoint, someone that can treat medical problems of the ear in a way that if they have an infection, if they have a tumor, if they have a problem that may have other causes that affect the ear, they're not in a position to look and see, well, what are the other things that might cause this and what can I do about it? Because I've been trained to be able to treat that. So I would say that there's a very distinct difference. We have roles as physicians and there are roles as audiologists, and we work together to ultimately provide that quality of care that we're talking about. We don't want the lines to be blurred when it comes to that quality of the care that the patient needs to receive at the end of the day.
Okay, I have Delegate Hill followed by Woods.
Thank you, Madam Chair, and thank you all for being here. I just want to be clear, and I'm going to get back to the question I asked the other panel in the analogy of the physical therapist. Before that, I just want to see if you, Dr. Pryor, I'll ask you, there's a definition here in the great Wikipedia that I'd like to know if you agree with. It says audiologists treat those with hearing loss and proactively prevent related damage by employing various testing strategies, behavioral hearing tests, autoacoustic emissions measurements, electrophysiologic tests, etc. They aim to determine whether someone has normal sensitivity to sound. Would you agree with that?
Most of it, with the exception of the statement that they treat hearing loss. They are not the only professionals that are involved in rehabilitation of hearing loss. I'm not sure we would call it treatment in that situation, but basically the audiologists are the appropriate professionals to fit, prescribe, program hearing aids. However, there are other ways to treat hearing loss. In many cases, hearing loss is a surgical situation where surgery is needed to restore or improve hearing, or implantable devices are used. In that case, the otolaryngologist would become the treating entity and the audiologist remains an important part of our team. They do electrophysiologic monitoring in certain situations, and I can't remember the entire list. We both do tinnitus counseling. We both do repositioning maneuvers, things like that. So there are areas of overlap, but most of those are non-controversial. For instance, the repositioning maneuvers that were mentioned earlier are, when I looked at the definition of the practice of medicine earlier today, those are specifically included because all they require are hands-on positioning. That's not included in the practice of medicine. It's fine that audiologists do repositioning maneuvers. In terms of the cost, I do them too. I'm cheaper because I can't bill for that maneuver where the audiologist can.
If I may follow up?
Sure.
Okay, so it sounds like part of the issue is that you think, as defined in the text of the bill, it suggests that where there's overlap, that they are the experts, and you would like it to be clear that there are some areas where they have expertise, but it is not broad expertise. That, for instance, within treatment of hearing loss, they have some expertise with certain types of hearing loss, but that your concern is that if it's not defined correctly, that it would suggest that they're the determinant of what the treatment should be for all hearing loss. Is that part of the issue?
Similar, not exact, but the issue is that the very broad and vague language leads to patients not being referred when they need to be. A patient has an infection and needs urgent prescription treatment or medication, then the medical training is absolutely essential there. If a patient needs imaging urgently, chances are they either need a prescription or surgery, or they need to be in the hospital urgently. And this falls within the purview of medical training. We've had more than just the 4 years of medical school. We've also had at least a 5-year residency program after that focused on ear, nose, and throat. And in the cases of otologists like me, we have additional fellowship training beyond that.
Madam Chair, may I have a little latitude as I did with the previous panel?
Go ahead.
Thank you. So just to be clear, the bill is very specific about what they cannot do, right? And so it says it does not include surgery. It does not include osseointegrated device surgery. It does not include cochlear implant surgery. It does not include the preparation, operation, performance of radiographic imaging. And when they ask to order cultures or order imaging, there's nothing in here that says that they're able to determine treatment based on that. It's sort of what they presented before was we order it, so the information is there so we can refer it on to the next person. You have it, is there an issue with ordering if you can't, I mean, I'll order, you know, I'm not a cardiologist and I'll say you need a monitor. I'm not going to order the monitor. But if for some reason the cardiologist was out of town, I might say, yeah, we'll order the monitor, but you're going to have to see the cardiologist to follow up. And it sounds like that's what they're asking for. So maybe a way that it can be worded, what's your problem with there being the order test to get the information a little quicker to refer it on?
So in terms of certain types of imaging, taking a photograph of the eardrum, I have no concerns about audiologists doing that. I think that that's an appropriate method for record keeping. So some of the imaging, the non-radiographic and non-MRI imaging is completely appropriate for their practice, and it's something that they already do. When we get into radiographic imaging, not every patient needs an MRI. Some of them need a CT instead. And that distinction is not always entirely apparent based on the audiogram alone. There are definitely many medical and what I would call systemic, meaning issues that affect the entire body, medication-related issues as well, that would affect what you're going to do, both in terms of laboratory testing and what you're going to do in terms of imaging. If a patient needs a culture sent, it either needs to be an invasive culture, meaning some form of biopsy or procedure is being done, which is in effect surgery, or when a non-invasive culture is being done, usually the patient requires treatment before that culture is being done. So usually we treat first, culture later. And so prescriptive authority would be required there. And that falls within the aegis of medicine.
You're welcome. Thank you for your expertise, Delegate Hill, and your questions. We have Delegate Woods next.
Thank you, Madam Chair, and thank you, Delegate Hill. You helped direct the question that I have, and that is, I'm trying to understand based on what, again, was said could and could not be done. In layman's terms, can you explain to me what is the difference between what a physician assistant does and an audiologist does? I.e., my physician assistant has, said that I had certain things, or she's referred me for testing. Now she's referred me for testing, and as a result of the tests, wrote prescriptions based on the results. Can you help me understand in layman's terms what the difference is between that and what an audiologist does?
So an audiologist is a separate profession from a physician. And the audiologists started out as individuals who primarily did audiologic testing. This also involves a certain amount of what we call vestibular testing related to the balance system, because the balance system is partially involving the inner ear itself. And so they're doing a set of tests to assess vestibular and auditory function. And then those results, and now that has extended, there are many more tests available now, such as the otoacoustic emissions that I think were referred to. So there's a wide range and battery of testing that they're used to doing. Audiologists are also very useful in terms of talking to patients about options for tinnitus, about certain repositioning maneuvers that we both use when there's a disorder of the vestibular system. And they're also absolutely critical for identifying the need for a hearing aid, prescribing and fitting and programming hearing aids. And as the science has progressed in terms of the ability to implant certain things, the audiologists are a very important part of our team. When we do surgery to implant devices, the audiologists work with, program, and fit the processors that work with these implants. So they do have a very specific and very important defined role. We work with them all of the time. They're very, very important parts of the team, but we do have different roles.
Madam Chair, do you mind if I answer that previous question as well
No,
for
No,
Delegate
because
Woods?
we only do one person, but you know what? I will have a follow-up question for you. So hold on a second. Delegate Woods, go ahead.
Thank you. So I understand. I hear what you're saying. I think I understand what you're saying. What I'm trying to understand though, is it seems to me like the audiologist actually can do more than a physician's assistant. And yet the physician's assistant can still prescribe medication and is not able to do certain things as have been outlined. And I'm trying to get some clarity as it relates to understanding the difference between the two.
Can I try, Delegate? Can I try to answer that a little bit? Because physician assistant, because that's been under discussion significantly this session. And I think we've got a near consensus bill, looking at the sponsor over there. But I'm just going to use an example here. Physician assistants there is a collaboration agreement with a physician. But furthermore, like there's just the example of what I had to do or what I did with the proponents of this bill, met with the lobbyists, met with the sponsor, and talked about the problem in the anesthesia world. They talked to their physician assistants, and the physician assistants said, we do this, this, and this. We do not do that, that, and that. Therefore, in the bill, they've accepted our amendment that says we are not going to do this, this, and this. It's that kind of specificity that we're looking toward. We're talking about here the collaboration, and we're all about the collaboration and the importance of what the audiologists do. But what we're lacking in this bill, and what we attempted in our first go round to do, is provide some specificity. And that's really where the problem is, and let's be specific. So there's the relationship that I could just call in terms of physician assistants.
I wanted to hear the question that Madam Chair was going to ask, but I guess.
Okay. Well, I think the question that Madam Chair was going to ask was, Dr. Dennehy, did you have more to contribute in the response to the question that I forget who asked the question? Delegate Woods asked?
Yes, I do. Thank you very much, Madam Chair. I think the question that Delegate Woods asked basically comes down to training. And the training for a PA or nurse practitioner is 2 years of working with physicians, doing medical management of multiple medical diseases, ordering tests, doing medications, which is not the same training that we're describing with audiology. That's why there's a difference in what a PA can do and why they're licensed differently. It's not that they're not capable of it, but that was not part of the training. So the whole training period for those two, even though they may be shorter, It's actually what you're trained in. It's not the number of hours, it's what you're trained in. And the medical management and ability to pick the correct test, pick the correct x-ray, understand the relationship between multiple disease processes, how they do audiology, and PAs and NPs differ. Thank you very much for letting me speak.
Thank you. Dr. Delegate Hill.
Thank you. Thank you for allowing me to come back. I wanted to get back to the question that I proffered and didn't follow up. And so I gave the PT, physical therapy example. So let me ask you this, Dr. Pryor, again, I'll ask you, from your perspective, what are the things that a doctor of audiology can do independently? I mean, once they see the patient, what additional analysis, ordering, testing, do you feel that they have within their scope that they're able to do in order to get to the endpoint, treatment, whatever? What do you feel they can do independently?
Audiologists, at least within the ones that I've worked with, are absolutely capable of administering a wide variety of audiologic and vestibular tests. So quite a lot of testing. They are able to prescribe, dispense, fit, and program hearing aids and the processors for surgically implanted hearing-related devices. They are able to use various modalities, including biofeedback and counseling and cognitive behavioral therapy for tinnitus training. Most audiologists are capable of doing what we call canalith repositioning maneuvers, which are hands-on, non-invasive maneuvers for treating vestibular disorders. And again, they're capable of taking photographs of the ear canal, looking at the ear canal, and using devices that measure movement and compliance of the eardrum, called tympanograms.
And based on the results of those tests, are they able to make a decision about this patient now should be referred back to, or should be referred on to, or we can now go ahead and recommend the following therapy? Do you feel that they have the training and the experience to be able to say, we've got this test result bound, this is the next thing, this is what I call the PT, evaluate and treat?
In some cases, they're entirely capable of doing that. In the example of an uncomplicated age-related hearing loss, they will proceed to the process of recommending, prescribing, fitting, and programming a hearing aid. In the situation in which they do vestibular testing and identify that a repositioning maneuver would be appropriate, in most cases, they will proceed to do the repositioning maneuver or refer to a physical therapist who can do the repositioning maneuver. In many other situations, a referral to a physician for potential systemic issues, for tumors, for infection, things like that is absolutely warranted. And for the most part, audiologists are working with guidelines that indicate when that referral is appropriate.
Delegate Alston? No? Okay. Delegate Johnson.
Thank you, Madam Chair. I want to kind of rephrase Delegate Hill's question. Is there anything in this bill that an audiologist could expand their scope within their training?
Here's my question. When you say expand their scope within their training, meaning something that's already within the training of the audiologists who are currently in practice?
Anything that they're asking in this bill to do?
Yes, there are things that expand the scope beyond what they currently do. And when we canvassed a number of audiologists, we found that many of them had not been trained in the ordering of laboratories and cultures or in the ordering of radiographic testing. Many of them had not been trained in using a microscope or microscopic instrumentation for removing foreign bodies or cerumen from the ear. It may be that those educational standards have been more recently updated. I do know that when the standards transitioned from a master's level degree to a Doctor of Audiology degree, there were online courses that allowed the current master's level practitioners to update to a Doctor of Audiology. And those people may have had less hands-on training than some of the newer audiologists, but many of those people are still in practice.
All right, thank you, thank you.
Any further questions? Seeing none, thank you all very much for your time and your
Thank you.
testimony today.
Thank you.
That completes the hearing on House Bill 464, and we will move to House Bill 878, where Delegate Bartlett has been waiting patiently, and that is constitutional officers, public disclosure of personal information. And Delegate Bartlett, our Vice Chair Bartlett, do you have a panel that you want to bring up with you?
I have a panel of one other person.
Okay.
And I touched the mic and I know better.
Okay.
I apologize.
Touch.
I know. As I'm reading the sign that says, do not touch the mic.
Thank you. Good to see you, Vice Chair.
Good to see you. Good to be here. First time in 2024. So it's good to see everyone. And just to let everyone know, I'm Sandy Bartlett, District 32, Anne Arundel County for the record. And I am here to introduce House Bill 878, Constitutional Officers, Public Disclosure of Personal Information. So we want to put some parameters around the disclosure of personal information. So if enacted, the bill will allow constitutional officers to the ability to request the removal of their personal information or the personal information of their family members. And so we outline in the bill how far down, the family tree we go from public disclosure. The bill mandates that a person who disclosed such information has 72 hours to remove it after being notified by the constitutional officer and or their immediate family member that they want it to be removed. If the party does not remove the information, they may be liable for damages to the officer or a member of their immediate family. As we have seen today, in today's political climate, both at the national and state level, tragically, government officials have been confronted at their private residences by people who may disagree with the decisions they've made while performing their public duties. House Bill 878 does not guarantee the safety of Maryland's constitutional officers, but it does take concrete steps to protect them and their families. This bill gives them a tangible way to keep their private information guarded and provides safeguards for them and their families. Thank you for your consideration. Thank you for not giving me a timer. And I request a favorable report by the committee on House Bill 878.
Thank you, Vice Chair. Mr. Hicks?
Yes, and good afternoon, everyone, and thank you for having me today. My name is Miles Hicks. I serve as Deputy Legislative Officer to Governor Moore, and it's great to be in the Health and Government Operations Committee today. Again, just to echo, thank you to Delegate Vice Chair Bartlett for all the great work that she's doing in the Maryland General Assembly and for bringing this bill. As she mentioned, this bill would allow constitutional officers to request their home address and personal phone number to be removed at their request. Since joining the administration, I've had the opportunity to work on a lot of different public safety issues. And one of the first ones that came across my desk was the actual safety of the governor and lieutenant governor. And I got to learn a lot from the state police about the hard work and the hours they put in and day out to make sure that they're protected while they're doing state business. And while I learned about those issues, I also learned about ways we might be able to fill some of these gaps that we find along the way. And this is just a gap that we saw last year. We actually had the opportunity to partner with the Maryland Judiciary on the topic. We actually separated them out this year, but we're glad that, again, we're taking the steps towards making sure that the constitutional officers can feel safe, one, and also, again, add an extra layer of protection as well. I also want to add, I know we've had some conversations with members of the committees. We look forward to continue to have those conversations and make sure that everyone's First Amendment rights are being protected, as well as additional folks that we might be able to incorporate into the bill. So again, I look forward to working with the committee, and thank you guys for your time today.
Thank you. Thank you for being here and your patience today. So I see a number of questions. I'm going to start with.
Oh, you all allow questions at HGO? I didn't realize. Oh.
But Vice Chair, we allow only one person to answer.
Okay. There you go.
So I'm gonna start with Delegate Hutchinson and go to Delegate Hill and then over to the left side, Delegates Alston and Bagnell. So Delegate Hutchinson.
Thank you, Madam Vice Chair. And thank you, Delegate Bartlett, for bringing this bill forth. When Miles came and met with me and really explained some of the background, why we need to have this, I just find it very unfortunate and appalling that we have situations where we need to have a bill like this. Really back to Miles, though, when we met, we had talked about, is the governor actually defined as a constitutional officer? Did you ever get an answer to that?
So I actually am still looking into that. I did go back and look into the state personnel article that you pointed out to me. He is not in that section, but I will be more than happy to.
I was going to say maybe something it's been overlooked, but constitutional officer also includes the Secretary of State. Does this bill include the Secretary of State?
This bill does not include the Secretary of State. I know some conversations we had as well with members of the committee were also looping in the Senate President and the Speaker of the House as well.
Yeah, that was my third part. I'm sorry, where did you end up with the Speaker?
I think we're open to those conversations.
Oh, sure. We're open to the conversations and just wanted to clarify that the constitutional officers are as listed in the Constitution for the Maryland Constitution. So that's where this is coming from. This group is coming from. Just to answer, so the governor is a constitutional officer.
Thank you.
To answer your question. Okay.
That was two people for one question, but okay. Delegate Hill.
Thank you. Thank you very much, Madam Chair. So quick question. I'm reading the bill. It's very simple. I don't see any penalties. So they are asked to take it down within 72 hours and they go, I don't think so. What happens then?
Well, if the constitutional officer or a family member is somehow injured as a result of not taking it down, injured doesn't have to be a physical injury, but they can sue for damages against that individual.
If to make them take it down, they just have higher liability that they wouldn't have if the person were injured without them having been asked to take it down.
That's correct.
All right, thank you.
Okay, Delegate Alston.
Thank you, Madam Chair. So my question is, have you all looked at the constitutionality of this? Because people have the freedom of speech and expression. And by telling people that they can't post or say certain things online or in a public forum, I believe you're infringing on that. And I don't know that we have a good cause to do so. You want to answer?
Okay, so I'll answer it as to the best of my ability. We have not gotten an opinion from the Attorney General. There have been some questions that have come up because we have a bill in Judiciary Committee where we're protecting the information of the judges as well as election board folks. So that answer if you stay tuned, I will have a formal answer to that question. I don't have a formal answer just yet.
Yes, thank you. And then the other concern I have is I was previously a member of this body and I received multiple death threats. And so did members of my family, including a bomb threat to my daughter's school. And we never were able to hide or not disclose my address. So if we're going to do this, I think it needs to be a little more deliberate than cherry picking certain people, because I know that there's a member of this body right now that received a very disgusting phone call with threatening language against her and her family. And so one, I think we have constitutional problems. That's the first part. The second part is, to the extent we don't, I think we need to be more deliberate in who we're looking at, because there are lots of people in this body on both sides of the aisle that say things that incite people, and they may want to find us as well. So we may need to, if we're going to do it, have it more expansive than just the people that are in that list, because we've all suffered.
I am presenting this bill to you all on a silver platter. Do with it as you will.
Thank you, Madam.
That's a smart delegate. Okay, Delegate Bagnell followed by Vice Chair Collison.
Thank you, Madam Chair, and thank you for bringing this bill. And I don't know if the bill speaks to this, but we had a very sort of shocking incident that happened in a public meeting where a member of the audience started putting on the public record the home addresses of a number of council members. Obviously, this is for constitutional officers, but my question is there a corrective action, since this speaks to the person who actually posted the information? Do we have the ability with this bill to take corrective action in public meetings, and or would you be amenable to that consideration as we consider the bill?
I would be amenable to that consideration. I think it kind of goes to the same thing that Delegate Hill was asking about whether or not the teeth is in here. There are other criminal actions that might arise from someone yelling out certain things at a public forum that are available. However, any amendments that the committee thinks would improve the bill, I am fine with them. I'm fine with them. And I would assume the governor's, I can't speak for the governor, but right. Okay. So one person can answer. So I can't speak for the governor, but I would assume that as long as the crux of the bill, the original purpose of the bill remains the same, if you want to expand, I don't think that would be a problem.
Okay. Vice Chair Collison.
Thank you, Madam Chair. So I'm just, I really appreciate the intent of the bill. And I'm just wondering how it works operationally. I was looking at the Maryland General Assembly website, and there's interim information for each of us there. And for those of us who don't have offices in the interim, our home addresses are there. So I'm wondering, does this bill intended for things like that, or is it just our information is put out there by a random individual who wants people to contact us, our personal information, and then we'd have to ask that person to remove it if the bill applied to us, let's put that way. But like, for example, the governor would, since he is covered under this bill, he would have to ask individuals, not necessarily an organization, unless there is an organization that's publishing it, right?
Right. I know specifically I'll speak on behalf of Governor, Lieutenant Governor. Our offices are open 24/7. We have those, the addresses on our sites are for the ones in the State House. This is for what you said, highlighting the particular individual, or someone sets up a website. Those are the people that we are really trying to make sure that we're encapsulating those folks in this bill.
Sure. Quickly. So you're saying somebody else sets up a website? I mean, I have a website with my cell phone numbers on my website. So if somebody else did that, then I could ask them to take it down.
Correct.
Okay. Thank you, Matt.
You're welcome, Vice Chair. All right, I don't see any other questions. Thank you very much.
Thank you.
For
It's
your
been a pleasure.
testimony today, and thank you for being patient and waiting as we called you, okay? Thank you,
you.
Vice Chair.
You have a blessed day.
You too. Amen. You too. Let's call Delegate Kaiser, House Bill 1053. And then Delegate Adams, I'm gonna call you after Delegate Kaiser, okay?
Thank you, Madam Chair. I appreciate that.
You're welcome.
To my right, I have someone here from the Department of Health who will be speaking. To my left is my intern, Matt Zinno. He's interning in my office this session. I chose him because last semester he was in one of my two ethics sections. And then of a class of over 50 students, I hope you blush, but even as a freshman, he got the highest grade in the class. So I am quite fortunate that he agreed to intern with me this session. But he's done the research on this bill, Madam Chair, so I'm going to pass it along to him. I'll
Thank
answer
you.
the questions.
Thank you. Welcome. And
Thank
that's
you.
quite a compliment you were just given.
Thank you. Good afternoon, Madam Chair Pena Melnick and esteemed members of the Health and Government Operations Committee. It is my pleasure to come before you to introduce House Bill 1053, State Board of Nursing Executive Director Qualifications. This bill originally required the Maryland Department of Health to conduct a study on the qualifications of the Executive Director of the Board of Nursing. However, it was brought to our attention that last year's reports from Ernst & Young and the Office of Program Evaluation and Government Accountability already considered the Executive Director's qualifications. Both of the evaluations recommended that the board remove the qualification that the Executive Director of the Board of Nursing be a registered nurse with a master's degree in nursing. We've amended this bill today to go ahead and remove the qualification. This change will take effect in July 2025 when the board gets back the responsibility of appointing the executive director. With this bill's changes, the board can continue to appoint an executive director with or without an active registered nurse licensee. I'd like to acknowledge that changing the qualifications of the executive director is not the solution to all of the Board of Nursing's problems. As you may have seen, the reports from last year confirm that many of the issues that face the board come from a lack of funding and understaffing. This bill is also not a reflection of the current executive director. Having read last year's report, it's important that this committee continues to work with the board to identify and implement other ways to resolve the broader issues. Thank you for your time, and I urge a favorable report on this bill.
Thank you. And thank you for your work. Very impressive. And she's a tough professor. So she says, you're good, you're good. Next, please.
Yeah, thank you, Madam Chair. Members of the committee, for the record, my name is Erin McMullen. I'm the Chief of Staff at the Maryland Department of Health. I'm also a constituent of the Board of Nursing. I'm a registered nurse. I am here today in strong support of Delegate Kaiser's bill and the proposed amendments to it. As you just heard, there's been a lot of work underway since House Bill 611 was passed by this committee last year. I want to thank you all for your support of the Board of Nursing and our continued partnership with them. Since that bill was passed, we have had those 2 independent evaluations. And as it was noted, there's lots of issues and progress that's been made under the board in the past year. Both DLS and then our independent evaluator that was contracted by the department did raise this issue around the executive director's qualifications. The only thing I would also add is just when you look at some of the other large health occupation boards in the state, there isn't a similar requirement that the executive director have to be a licensed or certified member of that profession. So this would be consistent with how we look at some of our other large health occupation boards in Maryland. For these reasons, we strongly request the committee's favorable report on this bill, and I'm happy to answer any questions you might have about the department's support of this bill. Thank you.
And thank you. I'm going to open it up for questions now. Delegate White Holland.
Thank you, Madam Chair,
You're
and thank you, Delegate, for bringing this bill and outstanding job in presenting the testimony, young man. I just wanted to inquire, as I see that while we may not be able to see any written testimony regarding unfavorable support, I was wondering if you could speak to if the amendments that are being proposed address their concerns, if you've had conversations with them.
Thank you for that question, Delegate. And I do have the amendments, and I apologize, Madam Chair. And I'm glad that you asked a question about the amendments, so I could have the opportunity to say that last week we were having some difficulty getting them in hand soon enough. And as soon as they were electronically shared with my office, they were immediately shared with all of the nursing constituencies to ensure that they got that information a day before the deadline to submit things. I would tell you that no, the amendment did not, however, satisfy their concerns. They didn't want the study, and they definitely don't want this change. I would argue that there's good arguments that were already made for why the change should still be needed. But in fact, the amendments don't satisfy their concerns.
You're welcome. You're welcome. I have Vice Chair Collison.
Thank you, Madam Chair, and I think this is for Ms. McMullen. How would you describe the role of the executive director of the board?
Sure. So I would, it's a multifaceted role, but I think one of the things that is really important and often overlooked is how much that person needs to be a strong administrator. While the boards are statutorily independent, they still have to work within the same bounds of government that the department does. So we think about HR, we think about procurement, technology. These are all things that the board's executive director really has to provide strong day-to-day oversight of, and then as well as the staff at the board. So I think those things are really key. Then that's also liaising with the board members who are volunteer members who oversee disciplinary licensure activities of the board. So I can't emphasize enough how important that strong administrator role is in order to make sure that we address some of the issues we discussed with you all at the beginning of session when we did a briefing on the board, process, IT, constituent issues, the day-to-day things.
Yes.
I didn't hear thank you for that. I didn't hear in your response a strong knowledge of nursing itself.
So I would say that as a nurse, I think nurses are wonderful. I think they're incredible leaders, but I also think there's so much clinical expertise at the board as it relates to nursing that the executive director might be a nurse, but I do not think they have to be. I do not think that is a qualification they must have to do that job effectively.
You're welcome. Delegate Rosenberg.
Thank you. I think Ms. McMullen, you're probably the better person to answer this question, but Delegate Kaiser, if you know, terrific. Do we have other instances under current law where we require that the executive director of a regulatory board be a member of the profession in the health department?
I believe that 3 or 4 other boards of physicians and other doctors, none of them require that the executive director have a license in the field at that time.
Are there any other questions? So just to be clear, with the amendment, you eliminate the study and basically removes the qualification that the executive director of the board must be a registered nurse with a master's. And what this does here with the amendments is that it says that the Maryland Board of Nursing can have the option to appoint an executive director with or without an RN license, correct?
Correct, Madam Chair.
And that recommendation was actually one of the Ernst and Young review that they had. And last year, if I may ask whoever can answer it, we put, the Department of Health actually put $10 million, right? Can you elaborate on that to help the board?
Yeah, so when House Bill 611 was passed, there was also $8 million in general funds appropriated to the department as the department assumed a role in oversight and infrastructure of the board's operations. So we've been working really closely with the board, with the Office of the Attorney General to make sure that we are frankly right-sizing the board's operations and processes and setting them up for success. So when they raise their fees, when they're able to address some of their staffing issues, that and once this House Bill 611 is ended, that they'll be able to be on strong footing.
And what that is doing is basically because we want to help the board, right? There were so many complaints, especially during COVID and afterwards. So this is to help them out. And the fees, the 10 million is not coming from their fees, right? That came straight from us, the state.
Yeah, that's correct. The additional funding is from the general fund. There's still certain things that have to be paid out of the board's special fund in accordance with the legislation passed last year. But yes, we're able to pay for a lot of different one-time operations, infrastructure costs, and other things.
And this gives you flexibility, correct?
Yes.
Right, thank you. Seeing no further question, I want to thank you, especially for Matthew, I just want to say thank you for your testimony today. We really appreciate it and your work. All right, we are now going to call an unfavorable panel. If I may, please, when I call you, come up. Catherine Ling, Robin Elliott, and Dr. Christy Waterman. And those will be the last witnesses for this bill. You will be so kind and come up. Delegate Adams will be with you shortly. Thank you for your patience and everyone else that is waiting. Good afternoon. How are you?
Good afternoon.
Good. You can get started.
It's not so late.
No.
So Robin Elliott here today on behalf of the Maryland Nurses Association in respectful opposition to the bill. Wanted just to provide some context. You all, I think, know me. Normally, I probably provide too much written testimony. Thank you, Delegate Kaiser, for getting the amendment to us as quickly as possible. There was a timing issue as well as the AT&T outage. Actually couldn't get a hold of our Maryland Nurses Association president. So we are in opposition of this bill, as you will hear from the panelists. Just to let you know, we have been talking with the bill sponsor as well as the Department of Health. We do have a difference of perspective on this bill, but on so many other things, we think that we are absolutely on the same page. And so we welcome being able to have those conversations. Thank you so much.
Thank you.
Madam Chair, Madam Vice Chair, thank you so much for this opportunity to speak before you today, as well as esteemed delegates. My name is Catherine Ling. I am here representing the Maryland Nurses Association, and we are standing in opposition to the amendment about removing the RN criteria from the executive director. I have been in caregiving or nursing for the last 38 years. I started off as a home health aide. I became a nursing tech. I was an RN at the bedside, a family nurse practitioner in the community, and I have been a nurse scientist and academician, for lack of a better, kinder term, for the last decade. As you can see from the variety of roles I've had over just my career, nursing has multiple entries into it with complexity. We have a variety of education levels, licensure, professional scope. Our executive director will need to make sure that they are looking at inter and intrastate regulations, given everything that we know about reproductive health at a national as well as state level and gender affirming care. They will need to administer our impaired nursing program. Also keep in mind that the preponderance of state professional boards of nursing, over 70%, have a nurse executive director that leads them. Our national state boards of nursing board of directors, 9 out of 11 of them have an RN. The only 2 who don't are working in specific licensure or fiscal areas. Nurses have critical backgrounds in IT. They have MBAs. They have degrees specifically in leadership. Many have a law degree. Other health professionals have 1 or fewer educational entries into preparation and 1 specific set skill of practice. Thank you very much for the opportunity to speak and to dialogue. Even when we don't agree, we do agree that we're all here to take care of Marylanders, and we really thank you for this time.
Thank you for being here. We appreciate it. Next, please.
Well, good afternoon, Madam Chair,
Good
Madam
afternoon.
Vice Chair, and committee members. Thank you again for having me here. I was just here, I think 2.5 weeks ago, right? On House Bill 728, where I testified. So I feel like I'm back home. Thank you. And I want to say thank you to this committee for really the excellent work that you do servicing the community and making sure that healthcare issues are addressed. I agree with my colleague, esteemed colleague here, but what I want to add to that, and it would be very short, is that as a profession, we have worked so hard over the years to ensure that nursing and nurses are seen as a professional organization. And I think it would really, and speaking to other colleagues and, fellow workers, it's taken a step back when we're saying that we're going to remove the requirement of having, and I know that it's not saying that we should not have a registered nurse, but we're removing that from in our statutes and saying that it could be anyone. It is so important. And as the immediate past president of Maryland Nurses Association, I cannot tell you how important it has been to me to have a nurse at the Board of Nursing, that when nursing issues arise, that I could have dialogue and communicate and have that understanding. So we all know that nurses come with MBAs and all different degrees. So it's nothing to have a nurse who will be able to fulfill these roles that I know that we just heard from the other group that presented today. So I do ask that you do consider what I'm saying here, and my colleagues do want to say that we don't want to feel like we're taking a step back with removing the person as the ED from being a registered nurse. Thank you all for your time and for listening to this.
No, thank you for being here and thank you for practicing. It's an important profession, so we appreciate it. I'm gonna open it up for questions. I don't see any questions. So thank you so much for being with us. We really appreciate it.
Thank you.
You're most welcome. Thank you for being here today. And this actually concludes the bill hearing on House Bill 1053. Next, I have Delegate Adams. And you have on your panel, Bruce Variano. If you both can take a seat and you can get started. Thank you for your patience. And those that are still waiting for their bill to be called, thank you for waiting. Good afternoon. How are you?
Good afternoon. I'm well. Thank you, Chair, Vice Chair, fellow committee members. For the record, I'm Delegate Chris Adams, happy to present House Bill 994, which is titled State Finance and Procurement Retention Proceeds. This is a reintroduction of a bill that I brought before your committee before. I'd like to start by saying this is already state law. This is a law that we passed in 2019. I passed the bill out of Economic Matters and Judicial Proceedings. That was House Bill 1231. And that bill applied to the real property article, which for our committee here today is private contracts. What we're doing here is we're taking the same issue, the same bill, and we're applying it to the state of Maryland under the procurement article. It took me 2 years to pass that bill. I will tell you that I remember the first year as we were trying to solve problems between owners and their contractors about how these monies are paid. There was negotiation. That same negotiation is part of the bill as it's drafted. And I would ask you to consider the fact that the owners have a right to protect their interest. They do that primarily by withholding monies. That's how it's done. But let's not mistake what retainage is, because retainage is not monies withheld for major disruptions on jobs for non-performance. Retainage is not for withholding money when there's major failures. These monies are held for the end of the project for what we'll call punch list items, specific performance on certain things that need to be corrected. And I believe that the testimony from the state of Maryland on certain agencies does, in my humble opinion, get the idea behind retainage wrong. The state has every ability to withhold money as they please when necessary to protect the interests of the state. So what's my bill do? It asks you, why does the 90-day period even exist? What's it there for? If the state of Maryland doesn't need any reason other than to protect the interests of the state to withhold money, then why are we talking about retainage? And the answer is that after the work's done, when a building is substantially complete, and likely when the owner, that is the state, takes occupancy of a building or project, there is a 90-day period. And during that 90-day period, there could be things that need to be corrected. Maybe there's some painting that needs to be corrected. Maybe there's some flooring that's not performing well. We're not talking about major failures under the contract. We're talking about minor issues of which the state needs occupancy for the building and maybe 90 days to make sure workmanship issues are resolved. And the assumptions that I'm going to ask the committee to make on this bill, and I think they're important assumptions to make, is to accept my testimony that retainage and the 90-day period and the withholding of those monies is different than the major ability for the state of Maryland to withhold any sum of money, progress payments and otherwise. The second assumption that I'm going to ask the committee to make is to understand that the 5% equals and in some cases exceeds the profit that a contractor and a subcontractor makes on a job. Let me explain. I'm not talking about the markup on a job. What I'm saying is by the time that contractor is paid overhead, paid their cost of goods sold, and when they've paid their taxes, there's what's called net profit. And I'm here to report to the committee that that 5% is probably exactly what a contractor makes at the end of the day when they're done at the end of the year. And so we have an obligation, in my opinion, to make sure the state respects and understands how important that 5% is, and that we can't be holding these monies months, and in cases, the testimony I'd give to you is years before these monies are paid. And I'll just close by saying that the last assumption, and I think it's important, is I'll reiterate the idea that if we're going to have a 90-day period, there has to be a starting point. It can't be arbitrary, and it can't be anything other than what does it look like from the side of a contractor and a subcontractor. And that's why in the bill, when we were dealing with owners under the real property article, we agreed that the date of substantial completion can, should, and does get written into the contract. And that if there's monies that need to be withheld for reasons that relate to how I describe it in the bill, undisputed amounts, if there are undisputed amounts, that money gets paid within 90 days of date of substantial completion. If there are disputed amounts, the bill isn't relation to this subject matter. And with that being said, I would ask you in this reintroduction of this bill to consider that contractors that have money, this is an annoyance, but think about the contractors in the state of Maryland that have found it difficult to survive and operate in the business of contracting and subcontracting. And this bill means everything. And I'm asking the committee on a policy decision to support and stand with these companies that do the work and have these monies paid in a timely fashion. Thank you for the opportunity. I would ask for your favorable report.
Thank you for your testimony, Mr. Mariano.
Good afternoon, Madam Chair, Madam Vice Chair, members of the committee. For the record, Bruce Bariano here on behalf of ACE, which is the Alliance of Construction Excellence Contractors. Very respectfully, and I do mean it, I'm very frustrated. I've been before this committee for 4 years supporting this bill. This is a very simple, basic bill, but a very critical bill. We talk, and we should talk, about equity, inclusion, about diversity, about women-owned businesses, minority-owned businesses. I'm before the Board of Public Works, contracts are given out, and things have changed, and I approve of that personally and professionally. But if people are not getting paid, it just doesn't work. It doesn't work. And look at the bill for a second. Under the bill, current law, we're talking about contractors that have to have a payment security bond. They have to have a performance security bond to the state of Maryland. So they have to have that. So the state is guaranteed there. And then look at the new language in the bill. Retainage is undisputed monies that are owed to the subcontractor. And retainage is defined in the contract between the parties. So nobody can play around. You look at the contract. But they are playing around because retainage is, as the sponsor of the bill indicated, who is a contractor himself and who knows his business, money is not being paid to subcontractors. And a lot of these subcontractors, very seriously, and I say this very respectfully, but I speak bluntly, are women-owned, a minority-owned, a veteran-owned, and they're not getting paid by the state because the contractor hired is holding the money, notwithstanding performance bonds and payment bonds and language in there. Please, we ask for some remedy and some help in the passage of this bill. I know you all want to improve the lives of everybody and leave nobody behind. Thank you very much.
Thank you. Delegate Taveras.
Thank you, Delegate Adams. And Mr. Varianos, my question is here, you're saying that folks should deserve payment prior to the completion of a project per the letter from the Department of Transportation. So that created this incentive once paid to come back and finish. Would you
No.
not agree?
So in my testimony, what I've said is that there is a misunderstanding, and I believe it's an honest misunderstanding about what retainage is and why the concept of retainage exists. This is not about non-performance. It's not about major faults or lack of quality workmanship on jobs. Remember that the state of Maryland under the procurement article can withhold monies for any reason whatsoever. What we're saying in this bill is that if there are undisputed amounts, and oh, by the way, non-performance or not finishing work is a disputed amount, is that those monies don't apply to this bill. My testimony to you, delegate, is that there are monies that are held by the state of Maryland that without this bill, there's no timeline that gets started. That 90 days is irrelevant. Okay, that's just how it is. And that secondly, if the undisputed amounts exist, my bill asks you to start the clock, okay, at a date certain, which doesn't exist under current law, and that within 90 days, the money gets paid. So this has nothing to do with the concern you have, which I would agree as an owner on private contracts, that we as owners have the ability to withhold money to make sure we have performance. This bill's already passed for private contracts because that question you've asked was solved through the amendments that you're seeing on this bill today. And I do believe, just in closing on this point, is that the state of Maryland, I believe, has a different interpretation of what retainage is. I can tell you, there's not a contractor in the state of Maryland or a subcontractor in the state of Maryland that doesn't understand exactly what retainage is supposed to be about. And they expect to get paid that in a timely fashion. Delegate, there's cases where contractors and subcontractors are waiting over a year to get paid. What I'm testifying to you is the profit that they earn on this job.
Thank you, Madam Chair.
Sure.
I hear what you're saying. I really do. But even 90 days to me, I just want to make sure we're talking about that we should pay within 90 days? Or, well, I'm just trying to get clear. What does this,
Okay.
because to me, if that means that a small business owner has to have their own money to pay up front and that they have to be without those funds for 90 days, it may be a concern and may hurt small businesses.
Well, that I agree with. Go ahead. Go ahead.
Make
Sure.
it less.
Okay.
Make it less than 90 days if you want.
Yeah.
But the point is, as I said, delegate, sincerely, we're talking about what's in the contract, the words of the contract that the parties have signed. I'm not seeing the letter, but that you're referring to from DGS, but they've signed a contract saying they're going to, as defined in the contract, release and give retainage, and they're not. And a lot of contractors, we're not talking about big contractors. Well, I've already indicated what I'm referring to. People are not getting paid and things are not getting solved. Aims and objectives and goals are not being achieved. Because if you don't have a cash flow, it's very hard to run a business. Thank you.
We have Delegate Johnson, followed by Shalega, followed by White Holland, okay?
Thank you, Madam
You're
Chair,
welcome.
and thank you for the bill. We know we got to get our contractors paid, especially our small minority contractors that don't have deep pockets. They need the money to keep coming in. They need their money so they can go to the next job. But you talked about punch lists.
Yep.
I want to make sure I'm clear on this retainage too. So the MDOT, in their letter, they say it would eliminate the incentive for contractors to quickly perform items on a punch list to bring a project to completion so they could receive their final payment. And then it says it would require payment of retainage within 90 days after substantial rather than final completion of project. So can you kind of elaborate on that a little bit so we better understand that, since you mentioned the punch list and they talk about the punch list?
So I'll absolutely answer your question. And MDOT and I believe, have an inherent misunderstanding of what retainage is. Let me put it to you like this. MDOT, I assume this is roads projects, okay? If there is a road project and it's a 1 mile project and the contractor finishes 20% of the road, they get 20% of the payment, and that the state holds back 5%. They continue to do the project. They get half of it done. They get paid half of the money less the retainage of 5%. They get 3/4 of the job done. They get their money less the 5%. That money accumulates, this retainage accumulates. They finish 100% of that road, that 1 mile road. They get 100% of the money less the 5%. And so the answer to the question is the state of Maryland has the ability to say that the job is substantially complete, less things that may need to be fixed, less things that may be punch list items, okay? And that 90-day period, that money, that last 5%, whatever that project value is, that 90-day period doesn't start until the substantially completion portion of that job's done. And more importantly, that it's undisputed amounts of money, that 1 mile road was done correctly, that the state of Maryland accepts it, and that you move on. MDOT is saying that retainage is something completely and utterly different. I'm saying that a percentage of progress payment for work that you've done along the way is how you pay. And if something got screwed up on that first 20%, then you don't get anything. If you do half of that road and you've paid that 20%, now you got to get to half of what that project was worth, and there's something wrong on that half of that project, that you hold that 20% or 25%. That's how you leverage the contractor. How MDOT is writing that testimony is to completely, and let me just speak, I need to back off for a minute here. With respect, I believe that there's a misunderstanding of what retainage is and why it exists. And there lies the problem for your small business, your women-owned minority business contractors, because they've done all the work and the owner has paid all the money, less the 5%, which is a honorable and end of project. There might be a few things that need to be fixed or cleaned up. And, you know, I'll stop there to say this, that we've had this bill a few years. This bill would pass if we could have the state of Maryland provide testimony that lines up with what I've just said, which is very true about the fact that the state can, at any point in time during the project, stop paying that contractor if performance isn't happening or it's done incorrectly.
You can, only
Yep.
one person.
Yeah.
Yes, you could do a follow-up.
Sure.
So are we talking about the 5% or are we talking about more?
No, just the 5%.
Okay, okay, all right.
Yep, that's right.
Okay, so we have, next, did I say Shalega? And then I said White Holland and then Shalega. Yeah, okay, thank you. And I have to step out because I have a meeting, so I'm gonna leave the very capable vice chair in charge, but I do want something. I wanted, Ms. Delegate Adams. I would like for you to work with, chair the subcommittee, Delegate Kerr, to bring in the MDOT and to bring in DJS, right?
Please.
We're gonna
please.
sit
please.
down to figure out what is the definition, right? What can we agree upon and see if we can work it out?
Thank you.
So Delegate Kerr, if you could do that, please, that would be great, okay? And use the conference room. Go ahead, Delegate White Holland, and then Delegate Shalega. I'll be right back.
Thank you, Madam Chair. And in fact, that was actually going to be my question, building off of what Delegate Johnson had inquired about regarding MDOT's letter. And so I just wanted to see, even prior to this hearing, if you've had any conversations with DGS as well as MDOT. I know that this has been a recurring issue, and indeed, we want to ensure that our contractors are paid in a timely fashion. And so again, given the recent charge by the chair, I would I know that there will be ongoing conversations, but if you could just expound upon some of the ongoing conversations you had even prior to this point, in seeing if there is an opportunity to really come really to the table to address some of their concerns, but also making sure that we can still make sure that folks are paid in a timely fashion.
Delegate, my client met in person with the Secretary of DGS. It was a very fruitful meeting. It was a very lengthy meeting, but just no results, no results at all. And I'm not being critical. I'm just we appreciated the meeting. We talked about it. My clients came in with small, medium-sized contractors, great diversity, and just haven't been able to get anywhere. And again, part of the frustration, and I'm sorry I'm repeating myself for a second, but we're talking about contractors that have to have a payment bond. They have to have a performance bond. What's the state worried about? And what frustrates me as a lobbyist is the agencies don't come in and appear before you and answer questions like we do. They send in letters. It'd be nice to get them in front of here and let's get some real testimony and dialogue. It's a continuing problem, 4 years and we're nowhere. And people that are really hurt are the small and medium-sized contractors and the diverse contractors.
Delegate White Holland, I would,
Okay, you're going on.
Yeah.
A little
Yeah.
over the line there,
Sorry.
Delegate.
I won't talk anymore. I won't talk anymore.
If Delegate White Holland would like to follow up, that would be fine. Don't touch the button.
Okay, I won't touch it. So Delegate Adams, would you like to expound upon my prior question?
You could. That's how we roll in
That's how we roll here.
all I was going to say is Delegate Kerr and I will engage in a productive way. And I've tried to maintain testimony that's honorable and respectful to the state of Maryland, by the way. But I've got to defend my turf. I'm a small business owner or contractor, and I wouldn't bring this bill and I'm not reading. I mean, this is from the heart, most of this, and it relates. So I'll be glad to work with the committee. Yep.
Thank you. Delegate Guzzoni? Is it Delegate Shalega? Okay, I can't tell where the light is. Thanks, Delegate Shalega.
Thanks, Madam Vice Chair. Thank you for bringing this bill. As a contractor myself who has waited way more than 90 days to get paid, I have walked in those shoes. And I think the way you've written this, undisputed retention proceeds retained by the unit shall be paid within 90 days. So they're not disputing this retention. So if a multi-phase job, I mean, jobs don't happen in a second. Look at that DLS building they're building over there, right?
Example.
So these are, multi-phase jobs, and 90 days is still 3 months that these contractors have to make after the date of substantial completion. So are you saying then that a foreman or a someone on the job could actually, if this bill passes, sign off and say, you can now pay,
Right.
Joe's concrete company, hit everything, because within 90 days, is that how you foresee that coming, working out, that would give flexibility to be able to do that?
Yeah. So I mean, so your point's well taken, one, and then two, we say that in the contract, that you can describe and define what substantial completion looks like. I will tell you that I'm a contractor that comes in, and date of substantial completion are in my contracts, and they start by a signature by me as the owner, a warranty period, a 2-year, in many cases, 2-year workmanship period, and that substantial completion does relate to the idea that the state of Maryland has access to, in many cases, the building or the space that's being remodeled. So date of substantial completion, the phrase substantial completion is not an arbitrary phrase. It has meaning in contract law, and it surely was something that we vetted for private contracts. So Delegate, all I'm trying to do is take what's already the law of the land. I said it from the beginning. It's good for the private owners. It can be good for the state.
So private owners are doing this now. We're
Have
just
to do
going to
this now.
say
Yeah.
that if the private industry has to do it, the state has to do it too.
I have the bill right here. I'll leave it as I walk out.
I remember that bill. Thank you.
Yeah.
Delegate Alston.
Thank you, Madam Vice Chair. So my question, and maybe a friendly amendment, is I actually think they need to pay you within 90 days. If you're doing like getting paid on a draw, and you get your first draw and the work is complete, then you go and get the next draw. Why aren't they giving you the 5% before you even get the next payment? Because you've 100% completed that portion of the contract before you even go to the next part, because if you didn't complete it, they wouldn't give you the next payment, right?
Right. So, I mean, retainage, again, we have to understand, and I'm trying to articulate the difference between a progress payment and retainage. Most people that enter into contracts understand retainage, if you're an early contractor, gets held at the beginning and you don't see it to the end. There are prompt payment laws in the state, and I believe the concern you have is addressed under a different part of procurement article, which relates to prompt payment. For these monies that get paid, like your 20% progress payment less the retainage, that number is 15%. If they don't pay that, I think they violate prompt payment laws in the state of Maryland, or I'd ask the committee to visit that subject, which is a little bit different than what I'm arguing and upset with right now.
Delegate Johnson.
Thank you, Madam Chair, and thank you. I just had one more question. So is the holdup, are the general contractors getting paid and then not passing the payment to the smaller subcontractors, or is it the problem of the general getting them?
My bill is and should relate to the owner, and that the owner pays that contractor. Again, if the contractor doesn't pay that money, then that's, in my opinion, violation of prompt payment law in the state of Maryland. So my aim on this bill is to deal directly and squarely with the state of Maryland, and that's very important to make that designation. Okay.
Thank you. Okay, seeing no further questions. Thank you, Delegate, and Mr. Bariano. It's good to see you. I have every confidence in Delegate Kerr.
We'll follow.
So look forward to hearing the outcome of your conversations. That concludes the hearing on House Bill 994. We will go now to House Bill 877, Delegate Phillips, Board of Public Works Transparency Dashboard. Delegate Phillips, you want to bring up your panel? I don't see Brianna January here. Do we have the virtual witness? Carla? Okay. You want to go ahead and pull her up?
If not, I'm ready to go.
She is here for you, Delegate. So Delegate, welcome. Please present your bill.
Sure, Madam Vice Chair, and I guess Chair, since you're sitting in the chair, Tullison, and members of the committee. For the record, I'm Delegate N. Scott Phillips, 10th Legislative District, and I'm here before you today for a favorable report on House Bill 877, the Board of Public Works Transparency Dashboard. I want to give you some background on this. I'm actually sponsoring this bill on behalf of the Legislative Black Caucus, as this is one of its priority bills in collaboration with the Office of the Comptroller and the Office of the Board of Public Works. It should be noted that we have amended the original bill. I will mention the amendments at the end of the presentation so you understand. And those amendments were done in collaboration with the two entities. Public dashboards for government procurement are important because they enhance transparency and accountability. They provide citizens, businesses, policymakers with real-time access to information about government spending, ensuring that procurement processes are open to scrutiny. This transparency helps prevent corruption, fosters competition, and allows stakeholders to assess the efficiency and fairness of government procurement practices overall. Public dashboards contribute to a more accountable and trustworthy government. Transparency in government procurement is beneficial to small and minority-owned businesses in several ways, and I do appreciate the conversation that you all just had, by the way. It ensures fair competition by making procurement process openly accessible, allowing these businesses to participate on an equal footing. Clear visibility into government spending enables small and minority-owned enterprises to identify opportunities and compete for contracts. Additionally, transparency helps build trust, fostering a more inclusive and diverse marketplace. Overall, transparency supports the growth and success of small and minority-owned businesses within the government procurement ecosystem. With that being said, monitoring our current Board of Public Works can be a challenge for the average person. Access to the decisions of BPW are not user-friendly nor easily accessible. This bill attempts to not only make the information more accessible, but also to delineate some of the information that should be included in the dashboard, to include things like the agenda, the MBE goals, the veteran-owned small business goals, small business reserve procurements. I want to reiterate, we work in collaboration with the Board of Public Works, the Comptroller's Office, and the Governor's Office for Small and Minority Business Affairs, GOSBA. And I want to thank them for working with us to craft this legislation. In the legislation, there were a number of things. One of the things you will note is that there were a number of referrals specifically to the comptroller's office and what the comptroller's office would do. The comptroller's office is still going to take the lead, but this is an effort of the Board of Public Works. So I will say, when you see comptroller's office in that area, it will be Board of Public Works. In Amendment 1, it will be transparency data dashboard, establishing a certain governance committee to review the contents of the dashboard. So there will be a governance committee created. Amendment number 2, the transparency dashboard required to be published on the Board of Public Works website. I believe earlier edition said the comptroller's website. Also, the Board of Public Works website, a procurement transparency, well, we mentioned procurement transparency dashboard. And then the third item would be the governance committee composed of the liaisons to the Board of Public Works from the offices of the governor, the comptroller, and the state treasurer shall review the contents of the dashboard for accuracy and completeness. With those amendments, which I will provide to the committee, as discussed with all of the stakeholders, I ask for your favorable vote on House Bill 877.
Thank you, Delegate. I'm going to go to your witness and then we'll open it up for questions. Ms. Chambers?
Good afternoon. Can I be heard?
Yes.
Wonderful. Thank you. Good evening, Madam Chair, members of the Committee on Health and Government Operations. My name is Carla Nelson Chambers, Managing Principal of the Nelson Ideation Group, LLC, or known as TNIG. And we provide managing consulting services to both the public and private sectors, specifically working with those clients on small minority and women-owned business goals. In my past experience, I was the director for the Mayor's Office of Baltimore City's Director of Minority and Women-Owned Business Development. And that was from 2007 to 2011. And I was responsible for the mayor's agenda as it related to the MWBE program. My role required me to focus on advocating, educating, informing, and promoting the interests of minority and women-owned businesses in the city and the greater Baltimore region. My office was responsible to review, interpret, and evaluate and implement various interdepartmental policies, practices, and procedures as it related to the contracts that those businesses were a part of. And we were able to do that through a program called CityStat. However, most of that was in a manual basis. And through that, we looked at the various efficacies and compliance with city, state, and federal laws and regulations. However, it was based on a 60-day delay in getting the information from those agencies. So I'm delighted to hear and to learn that the state of Maryland is taking this important step to move forward in providing public sector legislators, businesses, in particular, small minority and veteran-owned businesses and advocacy groups to make sure that there is transparency as these contracts come before the Board of Public Works. Providing accurate and on-time data is important to our business community, and I look forward to seeing more about this. So I fully support House Bill 877. Thank you.
Great timing. Thank you very much. So Ms. January has joined us. We're going to call on you next.
Thank you so much, Madam Chair, Committee. I am terribly sorry for my tardiness. It is that time of session where I'm running from one place to another. Brianna January with the Maryland Association of Counties in strong support of HB 877. You've heard what the bill does. Counties think that this is a fantastic idea. Not only will it provide transparency and accessibility for everyday Marylanders and our constituents and small businesses, but it will do the same for local governments. And in particular, that will have a huge impact for our smaller counties and municipalities that are less resourced, have less capacity to monitor and track every project before the Board of Public Works. So we are strongly in support of the bill and we urge a favorable report. Thank you.
Thank you. Questions for the delegate and his panel? Seeing, oh, Delegate Taveras.
Will we get it past this year?
Yes, we will. We're working. It's up to you.
Any other questions? I have a question.
Yes.
2 questions, actually. What have your conversations with the treasurer and the Board of Public Works and those offices? What have those conversations been?
They've actually been very positive. We started out with a collaboration primarily between the Legislative Black Caucus and the Comptroller's Office. And it quickly spread to all of the officers of the Board of Public Works. We've received input from all of the officers of the Board of Public Works, and therefore the amendments, and that's what you have in front of you based on that collaboration.
Thank you. So my second question, I'm a little concerned about the fiscal note. And so have you had discussions about that, particularly with the Comptroller's Office?
I've had discussions with the Comptroller's Office and with the Governor's Office. And they seem to feel that they can figure out how to address that fiscal note. And they're looking at someone, one or two individuals who would specifically be focused on maintaining this data because we think it's important. So my sense is that the Governor's Office and the Comptroller's Office are working through how they can make the numbers work.
Thank you. And I think one of the things in your conversations you might include, I know the Comptroller has a plan to upgrade their technology.
That is correct.
And I would think that something like this would be in that thought process as they move forward with that upgrade.
Thank you, Madam Chair. And that's exactly what's taking place. As a matter of fact, the Comptroller's Office has already begun a lot of this work without any additional requests for funding. I'm a old techie guy, right? This data primarily that they're scraping is in a PDF form, which makes it very, very difficult. So they're looking at some technologies that will allow them to pull down this data in a different way and make it more user-friendly so that they can then display it on the dashboard.
If we could get some information from the Comptroller's Office about how they would try to minimize this fiscal note, that would be really helpful.
Absolutely. Thank
Okay.
you.
Any other questions? Delegate Hill.
Thank you, Madam Chair. Delegate, thank you for bringing this bill. I'm thinking about your scorecard bill from last year, approaching it the same way. And it seems like the scorecard information needed to be posted. Can you help me understand the difference between the posting there and this dashboard? Or are these essentially the same or doing something different?
So Delegate, thank you for that question. They're actually very different things, and I'm hopeful that we'll see the scorecard data soon. But thank you for that question. No, this is something that will be ongoing. So we're looking at this as information that's kind of real time. So on a weekly basis, we'd have access to the dashboard. We'd see where we were. We'd understand if there were waivers given on a particular set of contracts, what the percentages are, because those percentages are based on the contract itself and not necessarily, a contract, the aspirational goal is 29%, but on a particular contract, it may be 13, right? So we would begin to see that and understand how the Board of Public Works is proceeding.
Okay. Delegate Lewis.
Thank you, Madam Chair, and thanks, Delegate Phillips, for the bill. Thanks to your panel. I think we need to do this. It's really essential, especially if we're going to leave no Marylander behind.
Absolutely.
And support the growth of small business. So, good bill. And yet, my question. Several weeks ago, we were, fortunate to hear a briefing by the state IT department, OIT, with their awesome new secretary of IT. And she and her team talked about their mission, which is to essentially modernize the entire state agency, IT ecosystem. And I just wondered where the comptroller's, website fits in that larger statewide IT mission. I ask because I know your fiscal note is a little bit of a concern. So I'm wondering if this project to modernize the comptroller's website could fit in or be partly offset by efforts that the IT agency is already doing.
So, and once again, I'm going to, so I can phrase this properly, it's not going to be the comptroller's website. This will be on the Board of Public Works website. But it is a joint project for which the comptroller will take the lead. The comptroller's office, in essence, has, as I understand it, has its own information technology team that focuses on the comptroller's office and delivers for the comptroller's office. I hate to be, I'm going to show my age. My history is that I actually worked for IBM and managed our business with the state many years ago, and that was always the case. So the comptroller, because of its unique responsibilities, has kind of always had its own information technology infrastructure. This would be part of their infrastructure. It would communicate back with BPW because they're going to be scraping that information and creating the dashboard.
Is there the opportunity for partnership with the larger IT, the statewide IT, whatever it's called? Why am I not?
Do
remembering?
it.
Do it. Thank you.
Yeah, the Department of
Yeah.
Information Technology.
And because they came before us and talked about the sort of hurly-burly, hokey-pokey, mismatched, redundant set of IT, systems, websites, a single agency with multiple websites that don't talk to each other, dead, broken links, et cetera. They are going to clean that whole thing up, harmonize, modernize. And I'm just wondering, why couldn't this effort fit underneath that? Or could they support it or to offset the expense and the complexity that you're looking at?
And I think that's something we can review with the comptroller's office since they're kind of taking the lead on this. And so I don't know the answer, but I'll ask.
Seeing no other questions, thank you very much for your time and testimony today. Delegates, stay right where you are.
Yes.
And that concludes the hearing on House Bill 877. And we will move to House Bill 962, Delegate Phillips, State Procurement Small and Minority Business Reserve Program. Delegate, you have Sharon Finder?
Sharon Pender, I believe.
Pender, I'm sorry. And we're gonna leave Ms. Chambers
Yeah,
up
we
on the
can leave
screen.
Ms. Chambers right where she is, if
That's
that's
right.
okay. All right. Once again, for the record, Delegate N. Scott Phillips, 10th Legislative District, and I'm before you today to request a favorable report on House Bill 962, which was cross-filed in the Senate by Senator Charles, Senate Bill 673. The bill from its original position was retitled the Small Business Reserve Program, and we're talking expansion. I want to kind of take a step back so you understand where we are, because the bill, as it will be presented, is significantly different than the bill that was originally sponsored. So once again, I'm sponsoring this bill on behalf of the Legislative Black Caucus as one of its priority bills and in collaboration with the Governor's Office of Small and Minority Business Affairs, or GOSBA. It should be noted, as I mentioned, that the original bill has been amended significantly. The Small Business Reserve Program was codified in 2004. The objective of the program was to increase opportunities for small businesses to secure prime contracting procurement opportunities in the state of Maryland. I want to repeat that. Our MBE program is a subcontracting program here in the state of Maryland. The Small Business Reserve Program is a prime contracting program. A goal was set of 15%. In addition, this is a race-neutral program. In our initial drafting of the bill, we added elements of the Certified Minority Business Enterprise Program to the Small Business Reserve Program. After discussion with the representatives of the Attorney General's Office and GOSBA, we were notified the bill, in order for the bill to remain race neutral, we really needed to pull all of that out. However, there are still some elements that we think are important. So the bill would enhance and expand the Small Business Reserve Program in the following ways. One, it will increase the goal of small business procurements from 15% to 20%. Second, it will require GOSBA to provide directed outreach to small businesses that are owned by economically disadvantaged individuals, as described in the State Finance and Procurement Code. And third, it will require a report to the Board of Public Works on the status of outreach, the number of aggregate dollars and amounts awarded to firms owned by economically disadvantaged individuals, with the ultimate, we believe the ultimate result is you will expand the diversity of minority businesses and small businesses and veteran-owned small businesses that are receiving prime contracts with the state of Maryland. With these amendments, as discussed with GOSBA and the Office of the Attorney General, I ask for a favorable vote on House Bill 962.
Thank you, Delegate. Ms. Chambers, want to go ahead?
Good evening again. For the record, my name is Carla Nelson Chambers, the managing principal of the Nelson Ideation Group. As a minority women-owned DBE, disadvantaged business, women-owned business, and small business, and I'm in the small business reserve for the state of Maryland, I've experienced firsthand the pros and the cons of the SBR program. So I'm delighted to learn that the state is seriously considering making amendments to this program as it relates to the structure of its procurement procedures to achieve significant percentage increases in the total dollars spent with the small minority and women-owned business community. As a small business owner and being certified, I often bid as a subcontractor, but this amendment literally helps me to be a prime and to be able to receive at the same time credit underneath the MBE goals. I ask for your consideration to emphasize the importance of face-to-face engagement and outreach sessions with the small minority and women-owned business community consistently, not just once or twice a year, but consistently, and make us aware of the various contract opportunities that is available to us. eMaryland Marketplace is okay, but often we receive emails that come in a little late in order to respond. And as small business owners, we're so busy doing our day-to-day work, it's hard to be able to get those emails in time. So having face-to-face in-session opportunities to talk to various procurement officers about these opportunities would be absolutely vital to our bottom line as we continue to work and look for opportunities. And I also think it helps to increase and hit the 29% aspirational goal. So with that, I fully support House Bill 962 for the Small and Minority Business Reserve Program. Thank you.
Thank you. Even 4 seconds under. Okay, I will open it up for questions from the committee. Delegate Morgan.
Thank you, Madam Chair, and thank you for the bill. Do you have any data? Has there been an expansion in minority-owned businesses, or would this 15 to 20% change just basically send more money to the existing businesses there already?
That's a good question, and I don't know that we will know exactly. What I do know is that currently under we've got a 15% aspirational goal. My understanding is we're probably somewhere between 11.5% and 12% in attainment. We don't know, and one of the reasons why we're asking for the report, we don't know how that's impacting kind of the diverse suppliers and providers. So we're asking right now, the GOSBA does not provide that data. So we're asking to really look under the covers to that to see if, part of the concept back in 2004 is if we expand this program to include small businesses, we create the small business program, it will have a positive impact, not just on small businesses, but diverse businesses as well. And so, Delegate, we don't know. We really don't know. And so we're asking that question as part of this proposed legislation.
Okay, thank you. Delegate Kerr.
Thank you, Madam Chair. Delegate Phillips, you mentioned a few amendments. I don't think we're in possession of those. Have they been drafted?
They have been drafted and they will be presented to you, and I have reviewed those with the interested parties. I could read them, but it gets a little long and technical. But I can, if you'd like me to. We'll provide them to the committee.
Okay, thank you. Thank you, Madam Chair.
Thank you, Delegate. Any other questions from the committee? Okay, seeing none. Wait, don't go anywhere yet. I have a question.
Yes.
So I think I heard one of your amendments be that we're going to perhaps change the minority business enterprise focus to economically?
Yes.
Okay.
The term of art is, and that remains in essence race neutral, is, what did I say? And I know this term, SETI, socially economic disadvantaged individuals.
Okay, and so that will replace the references to racial preferences.
Yes.
Okay, thank you. Another question I have is based on a couple of letters that we received. One was, and I think this is probably what Delegate Morgan was getting at, but whether or not the percentage could be wrapped up in the current 15% that we have, the goal that we have for our minority business reserve, or my small business reserve.
So I believe that question may have come prior to what we're talking about for amendments, because it looked at the way it was described is that the MBE goal would be wrapped into the small business reserve. We've taken all that out, stripped all of that out. It's just an increase of 20% for a small business reserve.
Thank you. And last question is, would you consider turning this bill into a study to kind of look at this, or period? Let me stop there.
I actually, I believe it's the right bill, because it's not going to negatively impact our program as it is today. My sense is that the governor's office, they've said that they want to increase their small business spend. I think this is in line with what the governor has talked about, wage, work and wealth. And so I would say, let's go with it. But if the committee comes back and says, Delegate Phillips, we want to move this to a study, I will not argue with you. I will reiterate that it is it was listed as one of the priority items for the caucus.
Okay. Thank you. Thank you very much, Delegate. I appreciate your time and your patience today, and being here. And that concludes the hearing on House Bill 962.
Thank you.
Okay. Oh. All right. Well, we will move then to Delegate Chisholm, House Bill 894, Procurement, Government of the People's Republic of China, Prohibition. No. That's okay.
What?
Thank you, Madam Chair.
Do you have all your panel there, Delegate?
I believe so. I think we have one virtual. You can pull your chair up, you're right.
Michael Lucci is a virtual. Okay.
Yep.
Okay, Delegate, please
Thank
go
you.
ahead.
It's always good to be in this committee. Hope all is well and everybody has been procured by now.
I think that was a dad joke, Delegate.
For the record, I'm Delegate Brian Chisholm from District 31, here to present HB 894 as amended. Just to talk about the amendment real quick, anywhere that you see Government of the People's Republic of China in the bill, it has been replaced to a country subject to embargo under international trafficking in arms regulation, short for ITAR. This bill prohibits companies that are in the international trafficking in arms regulation from entering into the Maryland procurement process, including Afghanistan, Belarus, Cambodia, China, the Democratic Republic of the Congo, North Korea, Russia, just to name a few. This is not a prohibition against any of their people. This is a prohibition against the governments and their adversity to us. So what is a problem that we're trying to solve with this bill? One, we are guarding against allowing foreign countries that wish to do us harm into our procurement system, posing significant risks to our state and national security, our economy, and our critical infrastructure. These countries can compromise the confidentiality, integrity, and availability of our targeted networks, introduce counterfeit or malicious products into the supply chain, and exploit business activities to gain unauthorized access to protected and personal data, potentially leading to catastrophic effects on security and the digital economy. Anyone here in here remember the cyber attack on Maryland Department of Health a few years ago? We need to vigilantly guard against monetary theft, intellectual theft, cyber attacks on our vital and national security institutions, attacks on our infrastructure that could leave us all without running water, supply chains, food, electricity, or communication, to just name a few. So the question is the threat real? On January 31st, 2024, just less than a month ago, FBI Director Christopher Wray warned Congress that foreign adversaries such as Chinese government-backed hackers have attempted to infect and target American critical infrastructure, including water treatment plants, electrical grids, and transportation system with the intent to cause real-world harm and wreak havoc through economic espionage and theft of innovation and personal data. Furthermore, many of these countries we wish to ban from our procurement process are some of the most egregious violators of human rights atrocities in the world, including forced child labor, sexual violence, enforced disappearance, inhumane acts intentionally causing great suffering through mental or physical harm. Just to name a few other examples, Russian hackers infiltrated Americans' electrical grid and attempted attacks on the NASDAQ stock exchange, the Bowman Avenue Dam in New York, and the Wolf Creek nuclear plant in Kansas. Let me just say this. I'm working on another bill in another committee that studies the electrical grid and the power grid. And the sensitivity of our grids was never as widely known to me as it is now. And it is vital to all of our survivals that is protected and that we understand the sensitivity of our power grids and what it actually brings to us all for our own securities. Russia has also been identified involved alleged procurement networks created to assist the Russian military and intelligence services in obtaining sensitive technologies such as military tactical equipment, airplane braking technology, and quantum cryptography in violation of U.S. law. Iran is also engaged in cyber activities targeting critical infrastructure such as attacks on rails or airport facilities that could lead to massive human casualties and food shortages. Politico just had this recent headline in November 29th of 2023. Federal government investigating in multiple hacks of U.S. water utilities. In June of 2023, Russia's cyber criminals launched a global cyber attack affecting several U.S. federal agencies. The attack exploited vulnerabilities in software used by these agencies. The New York Times just had a headline, U.S. hunts Chinese malware that could disrupt American military operations. The U.S. is investigating Chinese malware hidden in networks, controlling power grids, communication systems, and water supplies for American military bases. This malware poses a potential threat to disrupt U.S. military operations, especially in scenarios involving conflicts like those we have in Taiwan. So why do we as Marylanders need to take this up, and why shouldn't we just let the feds handle it? This is the important part. Chinese companies that have been banned or restricted by U.S. military and national security networks, such as Lenovo, DJI, Hikvision, and Lexmark, can still contract with state governments, just to name a few. If you think about our national security as a human body, Maryland is the heart of that human body when you think about where we are geographically. We have NSA, we have Fort Meade, we have Naval Academy, we have Andrews Air Force Base, and we are on the border of Washington, D.C. If someone wanted to strike at the United States without firing a single shot, Maryland is a prime location to do it. So let me talk about Lexmark, which I just mentioned. Between 2019 and 2020, the state of Maryland spent $61,402 of procurement dollars on Chinese technology from Lexmark. Also purchases were made by the Maryland Department of Health. Lexmark has been restricted from U.S. military and intelligence agencies due to their connection to the Chinese government and military. While federal policies direct information security at the federal level, states must determine on their own security standards, making states vulnerable to intrusion through the purchase of these risky Chinese technology products. Lexmark can access sensitive personal and financial information held by courts, police departments, election departments, education departments, child and family services, and other social services provided by our agencies. Blue Flame. I know some of you were here during COVID, and then if some of you remember, we had an audit given to us in December of 2021. That audit that was given to HGO and the Senate Education, Health, and Environmental Committee exposed to us that DGS and the Maryland Department of Health had purchased 1.5 million N95 masks at the cost of, and ventilators at the cost of $12,542. We had to send $6,271,000 as an initial deposit. On May 4th, DGS canceled that purchase. We never got the $6 million back, and there's still no evidence that we received anything. At the same time, DOJ was investigating Gavin Newsom's $500 million of PPE contract gone awry with Blue Flame. The Director of Federal Regulations of the Governor's Office at the time sent an email stating Blue Flame Medical LLC had a direct link to manufacturers in China and the Chinese government. Let me talk about Syngenta. Syngenta is a Chinese-owned company. It was acquired by ChemChina, and Chinese state-owned enterprise in 2017 for $43 billion that provides a significant amount of farming products to the state of Maryland. This is a major risk to our homegrown food supply. Syngenta's history is marked by controversy surrounding the safety of its products, allegations of corporate cover-ups. Syngenta was also aware of potential risks associated with a widely used pesticide called paraquat, including links to Parkinson's disease. Documents indicate that the company may have engaged in strategies to protect sales of the pesticide, including influencing regulatory environments and refuting external scientific research. This is from The Guardian on February 7th of 2024, less than 3 weeks ago. U.S. courts banned 3 weed killer and finds EPA broke law in approval process specific to 3 dicamba-based weed killers produced by Bayer, BAS, and Syngenta. So what can we do here? Well, 5 states have already started to limit these foreign adversaries from entering in their procurement process. They include Florida, Georgia, Louisiana, Texas, and Vermont. Despite federal bans on Chinese telecom products due to security concerns, many state and local government agencies have continued to purchase equipment from banned Chinese firms. The Washington Post just reported on a China strategy that seeks to infiltrate state officials and state procurement process. Let me just finish with talking about the fiscal note. The fiscal note says BPW lacks the expertise and staffing to develop a reliable list of entities owned, operated, or controlled that this bill would address. There is no publicly available listed of these controlled companies. However, Office of Foreign Asset Control does not maintain a list of these companies that BPW would use to develop this list. However, the State Retirement Agency contracts with a private entity to assist in identifying companies doing business with Iran, and BPW anticipates using a similar contractual arrangement to identify ITAR-owned proper businesses. SRA's contract consists of $12,500 annually, and they suspect this will be the same cost of this bill, $12,500 to protect our infrastructure. If we don't trust these countries to sell arms to us, then we probably shouldn't be doing business with them, especially considering we don't want to inadvertently support countries that are pervasively violating human rights, stability, and global security. Let me just mention this briefly. Yesterday, I had a call with a high school friend that was a Marine, became a Border Patrol agent, and now runs a very highly secure company in Arizona. He told me that they know of 31,000 Chinese males of military age that have come across that border in the last year. I can tell you that China doesn't let anybody cross that border unless they know who they are. And we have a misconception here that the border is controlled by Mexican cartels And I'm here to tell you it's not. Partly, yes, but it's controlled by the Chinese gang called Triads. They are the ones that peddle all of the fentanyl into this country. And I say that so everybody here is keenly aware that we have enemies that wish nothing but to do evil to this country. And we need to be vigilant on who we're doing business with in this state to stop the senseless killing through fentanyl and not expose ourselves to so many of these vulnerabilities that can come to us through our procurement system. With that, I conclude my testimony and I turn it over to my panel, and I ask for a favorable report on HB 894.
Thank you, Delegate. Who would you like to go first?
I think I'm gonna go first. Right. Hi, Madam Chair, Madam Vice Chair, and delegates. Thank you for the honor of testifying before you today. I'm Jackie Deal. I grew up in Maryland, and I've spent my career researching the Chinese Communist Party and its military, the People's Liberation Army, along with Chinese Communist Party history and strategy. And that's why I'm here to argue that this bill is necessary to protect Marylanders and your infrastructure. The Chinese Communist Party in Beijing is targeting state and local governments in the United States, including in Maryland, to secure contracts for its firms so that they can cultivate dependence on the People's Republic of China and amass data to coerce Marylanders. China, under Xi Jinping, the General Secretary of the Chinese Communist Party, has a strategy of military-civil fusion as well, in which the Chinese Communist Party claims the data of even nominally private or commercial actors to use that information for state purposes. So we need this bill to counter this threat, even if, unfortunately, it may cost Marylanders more in the short term. And I'm frankly sorry that decades of failed policy in Washington has put us in that position. But as you know, Xi Jinping is pursuing the China dream, which, if it succeeds, will be the US's nightmare. Since 2017, Xi has demanded that all Chinese firms and people secretly provide intelligence to the state. So any Chinese company with operations or products in Maryland would have to comply. That's why the FBI recently put out a warning about Chinese manufactured drones, such as DJI drones in particular, encouraging, quote, US critical infrastructure owners and operators to procure drones manufactured by US companies. The FBI knows there's a problem, in other words, but can't get folks in DC to fix it, so it's up to the states. DJI and other Chinese drones are cheap and appear to work, but as we've seen from the war in Ukraine, China can turn off and on critical features and get real-time targeting information from them, so how safe is that? And it's not just drones, as you know, it's vehicles, autonomous vehicles, which are sensor platforms. Xi has banned Teslas from sensitive areas of China, so why is Maryland buying trash trucks and transit buses made by Tesla's state-backed Chinese competitor, BYD? The Defense Department just banned the department from procuring batteries from BYD. And it's not just things that fly or drive, in conclusion, that we have to worry about. It's also biotech and pharmaceutical products and PPE, as you learned during the pandemic.
Ms. Deal, I'm going to ask you to wrap up.
They're all part of Xi Jinping's vision of being a network great power and winning the 21st century. Those are his words. So that's why I'm here, and I'll stop here and take any questions. Thank you.
Thank you. And who would like to go next?
Thank you, Madam Chair, members of the committee. My name is John Metz. I'm the co-founder and former president of an organization called the Athena Institute, which is focused on unwinding financial entanglements between the Chinese government, especially Chinese entities involved in the genocide of Uyghurs, and US universities. But I want to start by calling your attention to a recent tranche of leaked documents from a Chinese company called iSoon. Now, iSoon is a cybersecurity company, or at least bills itself that way. And it contracts heavily with the Chinese government, especially the Ministry of State Security. In this tranche of leaked documents, among relatively mundane things, there were also lists of targets for espionage, for hacking at the direction of Chinese government entities, detailed schematics on hardware backdoors, including hardware designed to look like power banks for iPhones and other hardware, designed to gain access to secure systems, among a variety of other extremely detailed documentation of exactly the techniques that companies like iSoon, of which there are very many in China, use to meet the goals of the state-owned entities and government entities that fund them. So the reason I'm calling your attention to this is that as of the summer of 2022, at least 38 states had contracts with exactly the kinds of Chinese companies that provide hardware that's subject to these kinds of security concerns. This is not something that is punitive in intent. It's something that is incredibly important to protect the data of Maryland citizens and to protect the interests of the state to ensure that that confidential state information is not leaked, to ensure that the state has supply chains that are not dependent on a state adversary, whether that's China or another country. So I strongly encourage a positive report on this bill, and I'm happy to answer any questions on this.
Thank you. Next, please.
Good afternoon, Madam Chair, Madam Vice Chair, and honorable members of the Health and Government Operations Committee. I am from Baltimore County, born and raised. I study politics. My name is Leo Hodjanowski, and I am one of Delegate Bandaria's constituents. It has been 2 years since the University of Maryland Baltimore County Student Senate and Finance Board each unanimously passed a resolution to recognize the ongoing Uyghur genocide and call on universities administrators to return our university to its stated mission of cultural and ethnic diversity, social responsibility, and lifelong learning. These resolutions called on administrators to investigate their direct holdings, managed funds, and other financial instruments for evidence of complicity in forced labor. They asked our university leadership to issue a public statement making their financial exposure to some of the most inhumane labor practices on earth, the ongoing eradication of the Uyghurs in the 21st century, known. Since that time, I have personally met with 2 Maryland University presidents, my university's vice president of institutional advancement, the University System of Maryland's Board of Regents, and many others charged with the duty of maintaining and improving our great system of public universities. At every level, administrators have been unable or unwilling to help. It is for this reason I have come to testify in favor of this bill, to safeguard our institutions against the most horrific abuses of human rights and the people who profit from them. Thank you.
Thank you. Is Brian Kavanaugh here?
No.
Okay, then I'm going to go to our virtual witness, Michael Lucci, before I open for questions. Mr. Lucci?
Thank you, Madam Chair, Madam Vice Chair, and members of the House and Government Operations Committee, Health and Government Operations Committee. I'm here to also recommend a favorable report on HB 894. I'm the founder and CEO of State Armor. We provide state policy solutions to global security threats. This bill is exactly that. We think that it's critical, first and foremost, to protect Chinese Americans and Chinese dissidents who reside within our borders, who are absolutely and undeniably targeted by the Chinese Communist Party regime. Operation Fox Hunt, which largely ran out of New York, but other cities, undermined the civil rights of Chinese Americans and Chinese dissidents operating here in the United States to force them to go back to China. But on this bill today, it's an issue of asymmetric warfare. Just like fentanyl, which is largely manufactured by a state-owned enterprise in China, shipped to Mexico, then to here, is a tool of warfare, so is what's called the civil-military fusion program, as some of the previous commenters mentioned. The goal is to make America and our allies and democracies dependent upon totalitarian technologies that will allow surveillance, economic coercion, and exfiltration of data that's very sensitive for the American people. The goal of this program is to dominate those technologies that have both a civilian and military use, so that if and when the Chinese Communist Party decides to start a fight with the United States of America, we won't have the technologies we need to counter them and to defend ourselves. For those reasons, and reasons mentioned previously, it's important that states no longer buy technologies from the Chinese Communist Party, whether it's biotechnology, genetic sequencers, or it's drones, or it's computers, or it's any of these sensitive technologies that expose our people and empower folks that really openly enslave people within their own country. Thank you very much.
Thank you. Great timing. Okay, I'm going to open it up for questions from the committee. Delegate Shalega.
Thank you, Madam Vice Chair. Thank you all for being here. I guess, Jacqueline, I'll direct this to you. What do you think the biggest threat is right now? I mean, the bill was opened up to many countries and other, you know, procurement items. What do you think is the biggest threat?
Well, I agree with the spirit of the bill in opening it up to countries on the ITAR list. I happen to study the Chinese Communist Party and its military, so I happen to think, you know, the Chinese Communist Party poses the greatest threat to our country right now.
In what way? You know, through technology, through IT, through what he was saying, you know, other biological.
It's a combination of the kind of dependence that they've cultivated on them by making themselves the manufacturer to the world. And we saw this in Maryland and in other places during the pandemic when, you know, we had to kind of beg, borrow, or steal our way towards PPE that didn't arrive, as Delegate Chisholm explained, that we paid for, and we didn't have access to the ability to make it ourselves. So that kind of situation is one in which you can imagine the decisions of senior leaders are constrained because they don't have the freedom to say, well, we can make our own PPE. We have to depend on our number one geopolitical adversary or rival. That deprives them of the flexibility to make choices, make policies to defend American interests. And it's not just in PPE, it's also in broader pharmaceuticals, it's in critical supplies for microelectronics, you know, energy grids as they transition to green have become more and more dependent on inputs from China. So it's across a whole array of the stuff that makes our country. And then a second area of huge vulnerability is the data, because so much of what we're talking about is now smart or has electronics, microelectronics built into it. So they get a huge amount of data. And as someone just mentioned, it's about the asymmetry, as Michael just mentioned, you know, they're collecting all this data about us, and we have very little access or insight into what's happening on the ground in China. They have all the access in the world here. We're an open country. And in many ways, that's very good, but it does create a risk in this area. So they can collect data on the personal medical information of citizens in Maryland. As was mentioned, you guys were hacked. I think the FBI director, Ray, recently estimated, or one of his predecessors estimated, that 80% of Americans have had their personal information stolen by China, and the other 20% have had part of their identity information stolen. So if there were war, say, how would that affect our decision-making or their ability to target, you know, at a micro level, decision makers or our command and control? So I absolutely agree with what the delegate said. You know, Maryland and places in the National Capital Region themselves are particularly vulnerable or at risk in this sense. But I guess to answer your question, I think it's a combination of our economic dependence or material dependence and the asymmetric flow of data that allows them to get almost micro level insight for targeting purposes here.
Thank you. Delegate Morgan.
Thank you, Madam Chair. So to streamline this bill, this is basically a procurement bill that stops Maryland from purchasing products, whether it be software or hardware, from people that hate us, correct? Is that it? Follow-up question. Do you know how much we currently buy from those nations of concern?
That's what I was mentioning. We definitely bought from, well, Lexmark we bought last year and the year before. We bought $62,000 worth. We've used the blue, I can't remember the name of the blue, whatever. And Syngenta, Blue Flame. Syngenta is somebody that we're definitely doing business with. How much of it is procurement dollars? I'm not sure. I know that a lot of the fertilizer and the farm products that they produce, which obviously just ran into serious legal troubles over the last 2 weeks, is purchased by our farmers.
Now you mentioned real quick follow-up, you mentioned Lexmark, but I'm not aware that Lexmark makes any type of proprietary equipment or software that's so great. There's tons of other manufacturers that we could have decided to go with. That Lexmark's just probably the cheapest brand that was sold to us, and that was the procurement issue.
Right, and why we did that, I don't know. And I think there's one thing that, if I may, so one of the things that and I would encourage everybody in here to watch a documentary called The China Hustle. And what China has been able to do is do what's called a reverse merger into US companies. So it's difficult, and I'm not giving them a pass on this, but it's difficult sometimes to find out who the real parent company is of some of these Chinese companies, because they'll take a defunct US company that's still traded on the US stock exchange and do the
Disseminate.
co-merger back together, and you don't know who you're really buying from. But that's why I think it would be great if we had a third party, just like our state retirement agencies, use a third party to figure out who these companies really are and who the parent company is and whether or not they wish us ill.
Okay, that makes sense. Thank you, Madam Chair.
Thank you, Delegate. Any other questions for the delegate or his panel? Seeing none, thank you very much, Delegate, and the rest of the panel for your time and your testimony today. That actually completes the hearing on House Bill 894, and we will go to the last bill of the day, and I will turn it over to the chair.
And I'm gonna give her a little break. So House Bill 959?
The last one.
Bandari. Yeah. We have Mitzi Fishman and Dana Kaufman. Will you be so kind and come up with the delegate? Trust me, he's good company. Go ahead, delegate. You can get started.
Yeah.
Thank you, Delegate Collison. I have meetings. You can get started.
Chair, Vice Chair, and members of the committee. This bill, the last bill of the day, aims to update and refine the continuing education mandate for certified dialysis technician, ensuring they have access to a broad range of educational opportunities essential for their professional development and patient safety. By adjusting the requirement to a total of 3 hours of continuing education, it really helps them to participate in the seminar, self-study courses, and providing CDTs with more accessible and flexible options to fulfill their educational needs. I do have two experts sitting next to me, left and right. So they will explain this bill more. Dana Kaufman from Javita, right?
Mhm.
Yep.
You're okay.
Whoever.
Dana, it's been a long day. Dana Kaufman on behalf of Davita. We're in support of this bill. It's probably the easiest bill you'll have all session. It basically, instead of requiring 3 hours of continuing education as drafted, it requires a 3-hour course. So it really limits the ability to take the continuing education. I actually do have an amendment though, just because we need to change the effective date on the bill. You remember about 2 years ago, you passed legislation that unbundled the CNA from the dialysis training. We are still working with the department to implement that law from 2 years ago. And one of the issues that was tying up the regs is this bill. So I don't want to wait for those regs any longer. So I'd like to be able to put an amendment to make the effective date sooner. Thank you.
Good evening, Madam Chair, Madam Vice Chair, members of the committee. My name is Mitzi Fishman, and I'm here to testify in favor of House Bill 959 on behalf of the Board of Nursing, who submitted the legislation for your review this session. So this bill alters the continuing education requirement for certified dialysis technicians or CDTs to require a total of 3 hours of continuing education approved by the board, rather than a single 3-hour course. As a result, this bill makes the education requirement feasible so that CDTs can get back to work. In the past, this legislature established the designation of certified dialysis technician and clarified the CDT's role working closely with registered nurses. This legislation builds upon existing law to support the workforce of CDTs in Maryland, who serve one of our most medically vulnerable populations. Across the state, over 17,000 Marylanders live with end-stage renal disease, and of those, nearly 12,000 depend on dialysis to stay alive. Many of these patients patronize the more than 100 dialysis facilities in our state, often several times per week. In addition, dialysis is a complex and highly sensitive process requiring skilled medical professionals to administer it. We need our CDTs to be ready to care for these patients with patient safety as the first priority. That means CDTs need easy access to comprehensive training and instruction. With this bill, CDTs will have access to more seminars and self-study courses, adding up to the required 3 hours of continuing education. And with that, we do request for a favorable report and thank you for your ongoing attention to the needs of the ESRD community.
Thank you, and thank you for being here with us. I'm going to open it up for questions now. Are there any questions, Delegate Riley?
Madam Chair, and
You're
thank you,
welcome.
Delegate Bandar for bringing this bill in the panel. So how does this apply to the ones that are actually, because there's several different dialysis machinery. So what about the ones that are at home that do it from home? Do those spouses or whatever, or caregivers, do they have the same requirements? I don't know. So, okay, so they can, so is that machine just easier to use that they're using at home? So it doesn't require this certification?
So this education requirement change is specifically for certified dialysis technicians or dialysis technicians. So technicians are utilized in different modalities throughout dialysis.
The homes get any kind of training for dialysis? These patients that elect to get dialysis in their home?
Home therapy patients, they do undergo their training through the organization.
Thank you.
Any other any other questions, Vice Chair Collison?
Thank you, Madam
Madam
Chair.
Chair.
You said this, I just want to affirm it. We are, instead of a single course now, you could take a 2-hour course and a 1-hour course or 3 1-hour courses, as long as it's 3 hours. Am I correct?
Correct.
Okay, thank you.
Any other questions or concerns? Seeing none, thank you so much. And I believe that this is it. This actually concludes the bill hearing on House Bill 959. And this concludes